Good morning and welcome. My name is Judy Myers, and I am the coordinator for the Children's Mental Health Program in the Children, Youth, and Family Consortium. We're glad that you've chosen to spend this time with us this morning focused on a very critical issue. Besides participants here in McNamara, we're also broadcasting this throughout Minnesota, and there are a number of people who are also streaming this individually. We can't do this work without the support of a lot of organizations and groups. And on campus, we're grateful for the Program for Health Disparities Research and the Center for Leadership Education in Maternal and Child Public Health. In the community, Minnesota Adopt supports us financially. And around the state, we have a number of organizations and community agencies that support financial participation for registrants at the local sites. We have host site facilitators, technicians, and our own tech support people here in McNamara who really help to make this run more smoothly, and we couldn't do it without them. And because this work requires so much team effort, I wanted to introduce you to a few of the CYFC staff who are here today. Sarah Langworthy is our policy coordinator. Brittany Henn, sitting at this table back here, is a grad student who is our children's mental health intern. Carrie Michaels is standing over here to my right, and I don't think that those of you in greater Minnesota can see their faces, but I'd like you to know about their work. Carrie is the lead for children's mental health and edits the e-review. Kathy Jordan, I don't think she's in the room right now, is our director, and Shiori Atsumi is at the desk registering people, and Jessica Barnes, who many of you know by name, is our communications specialist. Following today's seminar, you can pick up your CEU certificates out the door to my right if you're in McNamara. If you're at a host site, those certificates should be available to you at your site. Social workers can get their certificate after they confirm they've taken a post-test that's required by the Board of Social Work, and we'll have that up on our website by Tuesday. Lessons from the Field was established about 6 years ago. From the beginning, the purpose has been to disseminate cutting-edge information that reflects relevant research and best practices. By its very nature, research is sometimes slow to reach people in the field, and when it does, it may reflect a very specific population or problem, or fail to reach the professionals who might benefit from the results. Professionals who work in the field often have limited time or access to research, or may have difficulty translating the findings for their particular needs. Our role in the Children, Youth, and Family Consortium is to deliberately provide opportunities for research and practice professionals to come together. Researchers can translate their work in ways that are accessible and relevant, and community professionals can share experiences and knowledge that inform the researchers. We've covered various topics over the years depending on current needs and participant interests. For those who want to view past sessions, you can view these on our website, cyfc.umn.edu. We also publish e-review articles that summarize current research findings and include responses from clinical professionals in the field. A publication on homelessness will be available in the next week or two, and all of you will be mailed a link to that article. I hope that you'll take time to read it when it arrives. Today, we are fortunate to have a group of people who represent a high level of community professionals from multiple disciplines. Their work reflects recent research on homeless youth, the incidents, risks, and innovative intervention models. You'll also hear from several youth who will share their own stories about homelessness. You can look in your packets for more information about the presenters. We've had a little bit of a change this morning, as often happens, and Beth Ambrose is not here just yet. She's bringing the youth with her, and so that may explain why she's a little bit late. So we're going to adjust the schedule accordingly, and we're going to have Emily Human and Sergeant Ray Gainey talk first about their work directly with youth who are homeless. And so it's going to take me just a minute to bring up their slides.
Well, good morning. I'm going to get started. I have a little bit of an introduction I can do while we're working on our technical assistance. Thank you very much. Good morning, everyone. My name is Emily Heeman. I am the Program Director of Sexual Offense Services, also known as SOS of Ramsey County. We are a program with the St. Paul Ramsey County Department of Public Health. And we are what is traditionally thought of as the rape crisis service program in Ramsey County. So we have a crisis line, 24 hours. We provide confidential and free services to victims of sexual violence. We also provide services to secondary victims, and those secondary victims are the ones that are impacted by the sexual violence who aren't the primary person. So those are going to be friends and family and other concerned people. So we work with victims and those other concerned people in the community. A couple of things I want to just mention. I'm going to use the term victim, and the intent here is to denote the harm that has happened. It's not intended to be a designation or a label of that person, but you're going to find me using the word victim versus survivor. So I got into this work back in 1988 when I was a criminal justice student. Didn't know what to do with my degree, but saw And Justice for All. Anyone seen it? And Justice for All, Al Pacino, changed my life. I was in 7th grade. Changed my life. Decided I wanted to go into criminal justice, but I didn't want to carry a gun, so that was going to eliminate many jobs. I also didn't want to go into be a law student. Didn't want that much more education. Didn't have that kind of energy. So I didn't know what I was going to do with this degree. My senior year, I started working with victims of domestic violence and sexual violence. And I found my professional home there. I was able to use my skills and understanding and knowledge and interest in criminal justice on behalf of victims of crime. And I feel that that's been a very good fit for the last 25 years, and that's partly what brings me here today. So a little bit of background. I am going to focus on what Ramsey County has been doing. And because our order has changed a little bit, you're going to miss some basic information that we're going to have earlier about the state of Minnesota and the state of homelessness and youth in Minnesota. So I'm going to narrow it down a little bit and talk about what's happening in Ramsey County. And I'm going to talk about the work we're doing regarding homeless youth, runaway youth, and truant youth. And as Beth is going to talk after me, she'll be able to tell you a little bit more about the distinctions. And there are distinctions between youth who are running, youth who are homeless, and youth who are truant. And there is also some overlap. And Ramsey County has been working on what is that overlap, what does it look like, and what are the needs of those victims. So a little bit about homeless youth. Beth is going to cover that. A little bit about running. Youth who are running may or may not be reported to law enforcement as being a runaway. If you have a family that has a child who has run 10 times, they may call the first 9 and report it, but at some point they may stop reporting. You're doing a great job. I don't envy you right now. Okay. So victims who may be running may be a victim of interfamilial or extrafamilial sexual violence. They may have mental health concerns themselves or within the family. They may have experienced violence within the family. They may have learning disabilities. There's a variety of factors that impact a kid's decision, if it should be considered a decision for them to run. And Ray's going to talk a lot more narrowed down specifically about what we're seeing in Ramsey County about the kids who are running. We know from stories, we know from research that there are risk factors that are involved with kids who are homeless, youth who are running, and youth who are truant. I'm going to do a little bit of background regarding victims of this type of crime. Sorry, I'm going to do a little bit of background regarding child sexual exploitation, which is going to be the focus, and it's going to be on the population that is homeless, running, and or truant. My slide would be so cool right now. That's okay. It's amazing how dependent we get on our PowerPoints. Okay, on our slides.
Should we maybe just switch over to your?
Yeah, sure. Yeah, whatever you do is good. Yeah. Yep, that's great. Thank you. We're going between a couple of different slides. And I don't know who's... That's raised. I'm up. Okay. Thank you, everyone, for hanging in there with us.
Just from the very beginning.
Yes. Perfect. There it is. So, I'm going to be talking about... Thank you. I take no credit. Talking about child sexual exploitation and homeless, running, and truant youth. And as I mentioned, there is some overlap, and there is some important distinction between those three types of youth that we may be encountering who have experienced child sexual exploitation. So what is child sexual exploitation? There are a variety of terms that people use for this. In the federal law, it's called domestic minor sex trafficking. That's what you're going to find in federal law. I don't think there's anything in state law. Beth would know a little better than I whether there's a designation for this in the Minnesota state statutes. What you find in the Minnesota state statutes is criminal sexual conduct, and there are 5 degrees of that. You also find this also being called child prostitution, which is a term that we're really trying to encourage people not to use anymore. We want to see children who are victims of child sexual exploitation as victims of crime and not as part of the offenders who are committing this crime. The interesting thing for those who are working with this population, working with youth, is that they may or may not see themselves as victims of crime, which is going to change how you interact with them. And we're going to talk a little bit more about that. So some of the common forms of child sexual exploitation include pornography, internet, and what people consider street prostitution. And I want to just mention a little bit about street prostitution. That is what we think of when we think of prostitution, someone on the street being available to somebody who's coming up to them in a car or in some other mode. Prostitution is changing and going more underground in a different way. So many of these youth are not going to be kids you're going to see physically on the street. They're going to be kids that are going to be in somebody's house and being prostituted, being exploited. They're going to be in a hotel. They're going to be in a motel. They're not going to be kids we're going to necessarily see on the street. A little bit about victims of child sexual exploitation and gender. We know we believe boys are as equally vulnerable and victimized by child sexual exploitation as girls. What we do know is, however, we have a deficit of information regarding male victims of this crime. So if you can imagine, like I said, 25 years of doing this work, 25 years ago, what we knew about child sexual violence, what we knew was how not to be a victim. We talked to our girls about how not to be a victim, where they shouldn't go, what they shouldn't do to make sure they weren't a victim of crime. I have 4 older brothers, and not a single one of them received the same messages as I did. So I heard a lot about this is what a girl shouldn't do, so she's not a victim. And so we are living in that structure still today, and we're still talking about victims as girls. And we still have a lot of research regarding victims as girls. So I want to be clear that I'm going to talk about victims in the sense of the pronoun girl because we don't know enough, and Mark and Ray will be able to talk a little bit more about some of the other specifics regarding gender. So some of the things that victims of sexual violence, regardless of gender, victims of child sexual exploitation will be pornography on the internet, and street prostitution, which again is not prostitution on the street. So for girls, you're going to find girls who are victims of stripping, dancing, being controlled by a pimp. What we know at this point is that males often work more on their own, where girls are in some sort of a structure regarding being prostituted, where there is a hierarchy and a pimp. Just a word about note about the word pimp. That is to denote the person at the top of the food chain. So the pimp is going to be the person controlling what's going on and often has many people that they're controlling. So I mentioned earlier that you're going to likely encounter working with victims who may not see themselves as victims of crime. And this is because of what has been called trauma bonding. And that includes finding girls, boys, finding out what they need. And what do girls need? What are teenage girls wanting? Love, attention, care. They want to be thought of as the most important person in the whole world. They want to be given attention. And so what happens is pimps at the top of the food chain, pimps will find them and often give them exactly initially what they're looking for. A lot of attention, a lot of love, where that person feels like they're making a choice to be in that relationship. And then what you find is that being mixed with fear and violence, and you find victims of this crime feeling as if they've made the choice to be prostituted. They don't see themselves as a victim. That's also a very effective way of assuming people are disempowered, and no one wants to feel that way. And so this person has made a choice, has made a decision. They love this person. This person is who they're choosing to be with, and they're doing this for this person. They talk about the biological adaptation that happens in the brain. Anybody know anything about the adverse childhood experiences? So what we're learning is that the brain changes when harmful things happen to us when we're kids and when we're teenagers. And so we're finding research talking about biological adaptation, where the nervous system is literally biologically changing to adapt to the level of violence and harm that they're experiencing. So what you think is tolerant at one level, after experiencing things, you've become used to it, and your tolerance becomes higher. So victims have a hard time finding services. And the first difficulty is what we've already talked about, is they're not seeing themselves as victims. Now, Ray's going to talk specifically about a case that they have where the person did call 911, saw themselves as being a victim, and was completely able to go into those level of interventions. What's harder for us out in the field is working with people who are not considering themselves victims of this crime. And because they are not seeing themselves as victims of this type of crime, they're not being identified by us. They're not being identified by the police. They're not being identified by medical care. They're not being identified at schools. They're not being identified by family members, by their community, by their churches. Or they're being misidentified. And that's what we're trying to work on in Ramsey County, having those kids not be viewed and put in the box of being a criminal. We want to start viewing them as a victim of a crime and take them out of the criminal justice system avenue as offenders. So how do you identify a victim? Here's some of the things we know from research, what we know from women and minors who have survived this type of crime. Here's some things from the field to look at. And some of them are concrete things, and some of them are the emotional level of bonding that that person may have with that offender. So the first thing is being tired. Every teenager is tired. Every adult is tired. So you want to be paying attention if they're tired. Why are they tired? What are they telling you? Where are they? Days, nights, weekends? What are they doing with their time? And you combine this with a recent significant change in their appearance, which can include clothing, jewelry, other things like tattoos, other things that are going on with their body. So some sort of a significant change with that person. And then talk to that person and find out who they're hanging around with, who they're with. And this was an interesting comment that I've heard from research and I've heard from victims of this crime. Talk about their dreams. Ask them what their dreams are. What are they wanting to do with their life? And did they have dreams of becoming a veterinarian and now they want to own a record label? Are things changing, and is that based on the relationship? Is that based on who they're with? Are they running away? Are they not in a safe home at night, in a bed that's safe with caring adults? Where are they? If they have some sort of connection with a gang. Unexplained injuries. So this harkens back to work with domestic violence. Is there harm, physical harm you can see happening to that person, and they're not acknowledging where it came from? Black eyes, I ran into the door, I fell, cuts, marks, other harm. Change in appearance, staying out late, and your mental health concerns. Withdrawing from the family, and changes in attitudes. And again, this is not prescriptive. This is not one of these things equals a child who is being a victim of child sexual exploitation. This is an idea, a start, a beginning for those in the field who are working with youth and who may have some concerns. And if you have 3 or more, 5 or more, you might want to be talking to that youth more about what's going on in their life. These are not people are going to come to you likely and say, here's what's going on in my life. To admit that to a professional, to somebody out in the community is very difficult. And like I said, it's often disempowering. And people don't want to feel disempowered. Youth don't want to feel disempowered. So they want to be at a place where they're feeling empowered, and the trauma bonding mixed with this can allow them to feel as if they have some power. So who are these men, or who are these pimps, these top of the food chain people? We do know 2 things. They are overwhelmingly male and overwhelmingly older than the youth, the victim of the crime. Ages can vary. And again, initially and intermittently, they show the victim a lot of attention. So what do we know about hierarchy of needs? People need care, food, shelter. So if they're running, if they're truant, if they're not at home, if they're choosing to be not at school, making some other choices that we understand to not necessarily be healthy choices, are they getting their needs met from someone? How are they getting those needs met? Where are they staying? What are they eating? Who are they with? And then asking about who that person is or people, who those people are. If the adult, the male adult, who she may say things like, I love him, likely to be in love with him, likely to have attached her life and her dreams to him, even though she understands she may be one of many. She may say he doesn't have an actual job that she can identify. She may not be able to tell you much about him, but she may love him. He may have fancy clothes, he may have jewelry, he may have cars. And again, going back to domestic violence, isolation. So you want to pull her away from the ones that love her and care about her and support her. And those are going to be family, those are going to be friends, there's going to be school personnel, other caring adults in her life. You don't want that person with them. And he may say things like, you know, it's them or me. You're going to make a choice. I love you. I will do everything for you. I will make all your dreams come true. I will make our dreams come true. I've got a whole life plan for us. You know how much I love you. Don't make me have to hurt you. Don't make me have to make you do these things. You're going to have to choose. Do you want them or do you want me? Victim sanity gets questioned. You start wondering if what you're seeing is real, what's happening is real. You start putting it into different places in your head and in your heart, the things you're experiencing and seeing from this person that you love. He will make her afraid to leave. He will threaten her with violence. He may hurt others around her. He may hurt women that she cares about, other women that she's with. may threaten family, may threaten a little sister. I know where your little sister's at school. I can find her. If you keep doing this, I won't go find your sister. I know where your family works, or where your mom works. I know how to find your family members. You liked that little dog, didn't you? We can get a little dog. We can attach you to many things, and then we can take them away from you and watch you become harmed by losing them. And again, that trauma bonding, what happens inside our heads and our hearts is that we start attaching ourselves to that person. If I only do X, they won't do Y. And what is X? X is a variety of things youth, adults never thought they would do. And what is Y? Y is whatever he says. Whatever he says you're going to do. The last bullet here is talking about dreams, and I just again want to mention that victims of this type of crime will talk about that. If offenders find victims who are teenagers, often a teenager has a dream or dreams, all sorts of things you're hoping for. And those things will change. And what's important to him is what's important now to her. So we talked a little bit about this needs of victims of crime, of minor victims of child sexual exploitation. And it goes back to that Maslow's hierarchy. And I was at a conference with Ray Gainey, who's going to speak in a minute. And one of the things that was simply overwhelming, which should not have been, was the need for food. So you talk about law enforcement picking up someone and having some granola bars and water in their car, making an attempt to connect with that person in a different way. Really basic needs are very important. Shelter. We have a crisis of shelters, which I think Beth is going to talk about. Crisis of shelters for our homeless and our running youth. Where are they going to stay that night? Are we going to put them in the juvenile detention center? Because as I know of good people in the county attorney's office who say, at least I know they're safe for one night. They're going to get some food. They're going to get a bed. That's one night. That's what I can do for them. They need an exit strategy. They need to know, where am I going next? Are there any options? What do you have that is different, better, and safe from where I am? And those are many things that we're working on very actively in our state and in Ramsey County. We are working on exit strategies. We don't know. We don't know all the answers. But we know some of the answers, and we know some of the things that everybody needs. They need safety, somewhere to be where they're not going to be harmed. And then you get into jobs. You need somebody hiring them. They need an alternative to where they've been, to what they've been doing. Something that they can find valuable and find rewarding for themselves. And they need emotional and mental health care. They also need professionals who work with them to be trained, to be experienced. This is what I would consider from a healthcare perspective. You want a specialist working with kids in this situation. You want someone who has knowledge, experience, background, understanding, and is working probably in a team approach with many other professionals who can help surround that kid, figuratively, with support. One person alone isn't going to do it. One person alone can help identify. So what influences child sexual exploitation? Our economy, and overwhelming, it's point number 2, which is a demand. If no one wanted to buy a child for sex, we wouldn't be here today. Our attitudes towards children. And so when you're looking at leaving here today, I ask you to think about a couple things. One, as an individual, you're here today, that's great. You're listening and you're taking information. So what do you do next? If you're looking at the ecological model, you want to be doing something with your family. Go home and talk to your partner, your family members, people in your neighborhood. Tell them what you learned today. You want to be talking to your community. Who is your community? Everybody's got a different sense of who their community is. It could be a neighborhood, it could be church, it could be your school. And then you want to talk about where you make impacts on society. And again, I really emphasize, if no one would buy these children, they wouldn't be victims of crime. Ray's going to talk about who are the people who are buying these children. So Ramsey County has worked on this in a variety of ways. So there was a recent study that came out from the Minnesota Indian Women's Resource Center talking about where we're putting our money. So for every dollar we put into early intervention in this area, government is saving $34. That's something that our counties are paying attention to. And that was only really hard costs that were included in that savings. So again, here's a whole list of things Ramsey County's been working on. The Safe Harbor Youth Intervention Project, public health, nurses who do home visits are now screening for sexual violence. Our juvenile detention center about 3 years ago rearranged their intake form, and they ask about sexual violence. And they don't say, were you a victim of sexual violence? They ask, what are you experiencing? What kind of sex are you having? And is it chosen? Are you using condoms? And they're looking at that as in a professional lens of, you're not going to say I'm a victim, but you may say, I don't use condoms, I've had sex with 10 people in the last week. You may talk about other things, and the professional needs to take that information and say, this is concerning, and start asking further questions upon that information. The St. Paul Police Department has been doing a fabulous amount of work, and I'm going to let Ray talk about that. Our Ramsey County Attorney's Office and the Metro Prosecutors 2 years ago, before any changes in law, the Ramsey County Attorney's Office, along with Dakota and Hennepin and Washington and Anoka, came forward and said, regardless of what the law says, we will no longer charge minors who are being prostituted. We will not charge them as offenders. We will treat them like the victims they are. Now, this is extremely noteworthy because that was not what the law was saying at the time. And we now have law that does echo that, and it doesn't go into effect till August 1st of 2014. So we had our Metro prosecutors come forward and say, well, before law was changing, we're not going to do this anymore. And then you had law enforcement saying, great, we're not going to do this anymore. What do I do with that kid? Nothing good happens at 2 or 3 a.m. I pick up a kid at 2 a.m. That's always a story. I find a kid at 3 a.m. What am I going to do with them? And that's where we are today, trying to find exit strategies that are safe and effective. And we have some things in place, some things started. We have policies and procedures supporting that, and we have actions and understanding by our law enforcement and our human services officers, human services staff, and by medical staff. Lastly, we also have Ramsey County commissioners supporting this, saying that they will support this in policy, and they will go forward and help other counties understand this. Within Ramsey County, we are helping, the commissioners are assisting other counties in looking at this and trying to determine what do we do. What do we do again with that kid? We don't know what to do with them. When we find them, we don't know where they should go. And so our commissioners are saying we will help provide leadership within all the Minnesota counties. So the Safe Harbor Project, Safe Harbor Youth Intervention Project. And you can find this on the website. I forgot to add the web address. Did I? I did add it is there. Look at that. Okay. SOS Ramsey County, you will find this document. It's about 300 pages. It includes resources for youth, resources for adults, the actual protocol, and then the beginning of the protocol starts with talking about cultural competency. So if you are saying, ours is a community that wants to start addressing, working with this community, you need to be considering all the different aspects that will be important for that person you're working with, including working with GLBT youth, working with youth from varieties of communities. And again, the SHIP project looked at the overlap, and that is an estimate of the overlap. We have no idea. Is it 95% overlap between kids who are running in truant and homeless and being exploited, or is it 5%? We have some sense of that, but we're just beginning to get a really strong, concrete idea, and Ray's going to talk a little bit about what we know in Ramsey County. And again, public health started asking questions. because we know the long-term impacts that sexual violence has on us. Juvenile detention centers started asking questions, and when juvenile detention centers started asking these questions and intake staff was going to be asking them, they wanted some training. So we spent a lot of time training staff before we ever implemented any sort of policy changes. I'm going to turn it over to Ray.
Thank you, Emily.
Thank you, Ray.
First off, I guess I just want to say thank you for inviting us over today to talk about this issue with homeless youth and sex trafficking. And second thing, when I stand up here and I see all these bright lights, the cop in me wants to turn these lights on you guys and start asking you questions instead of the bright lights being on me. So hopefully I won't do that. Everything that Emily said, you guys, is true. I was sitting there listening to her talk as she went through her points, and I could think of a girl or a story that went with each point. So she is spot on in what she's talking about. Again, I'm Sergeant Ray Gainey from the St. Paul Police Department. I've had the unique opportunity of working in both our juvenile unit as an investigator and also in our vice unit as an investigator. So I've been working with these girls for a few years and certainly have enjoyed my time in doing that. It's great work to do. It's fun to interact with these kids, but it's also great to lock these folks up that are abusing these young girls. So that's really what motivates me each and every day when I work on one of these cases. We know each and every day if I'm investigating a case that I don't do something on that case, that pimp is going to find some other girl to lure into this lifestyle. And we can certainly show that that happens every day. So one of the reasons we're here today is our partners around the country are reporting that gangs are expanding their work into prostitution. It's happening all over the country, and it's certainly happening here in Minnesota. If you follow the news at all, you've seen several recent cases involving some of the gangs. Most recently, a high-profile one out of St. Paul was involving the TB-22s. If anybody saw that in the news, brutal gang rape. But so we know that the gang activity is expanding into prostitution, and the simple reason they're doing it is just about money. They are looking for opportunities to make more money for themselves and also for their gang. So why are they going into prostitution? If you look at the next slide, commercial sex, we know that several of these gangs or several of these pimps will have more than one girl that works for them. These girls will often have a quota. These girls are not allowed to come back in or finish their night until they've earned a certain amount of money. And you're all smart. You can do the math up there. If I'm a pimp and I have 2 girls, 1 girl, 3 girls working for me, and she goes out and visits John's and hotels, homes, wherever it is, she comes back and she turns that money over to me. So that's what's motivating these pimps, is the almighty dollar. And we look at that compared to selling drugs. I used to work in our narcotics unit. If I'm a drug dealer driving around the city of St. Paul with a pound of marijuana under my front seat, there's a certain amount of risk that goes with that, right? If I get stopped, cop finds the marijuana, I'm going to go to jail. If I'm a pimp and I'm driving around and I have a 16-year-old girl sitting next to me in my car, I'm not going to go to jail, right? Cop may look at me and say, who's this? They're probably going to have a story on what their relationship is, or I'm just giving this girl a ride. But it's not illegal for that pimp to be with this 16-year-old girl. So there's a lower risk for these guys. That's why they move into sex trafficking. The other thing is, if something happens to this girl, if she's a runaway, if she gets arrested, gets placed in JDC, or if she goes someplace else, that girl's going to be replaced. There's an endless supply of vulnerable youth out there for these men to prey on. So they're simply going to find another girl if something happens to her. We can't do a presentation on sex trafficking without talking a little bit about Backpage. As many of you know, Backpage.com is where these ads are placed for these girls. One thing about pimps, when they use this site, most of this activity is done with prepaid credit cards. It's done with prepaid cell phones, and it's also done with fake email accounts. These guys do everything they can to try to hide their illegal activity. Backpage, if you were to go on Backpage at any given day, you would find hundreds of ads for escorts in St. Paul and Minneapolis. The girls will say on there that they're 18. They're not always 18. Each and every time we go out to do an undercover sting operation, if we focus our efforts on trying to find girls or women, we'll come across an underage victim. Backpage, they're very quick to respond to us when we request information from them with a search warrant or a subpoena. And they claim that since they are so helpful, their claim is that if they weren't providing that service to law enforcement and ads were being placed on another site, that maybe those other sites wouldn't be as helpful. So they continue to operate. And Backpage has made millions and millions and millions of dollars off of young girls being sold on the internet. So, yeah, so enough about Backpage there. I'm not a fan. Hopefully that came across. Let's see. This should, we'll see if we have a 911 call in here. I don't. Let me go back a slide. Oh, I don't see it on there. We'll try to play a 911 call for you from a victim that was trafficked to Minnesota. It just didn't pop up. So.
It was in the other presentation.
That's what I was afraid of when we were.
Just go directly to.
You want to stay up here, Raleigh?
Yeah.
Okay.
Hi, this is Bonnie, and I'm a runaway from Des Moines, Iowa, and I'm in big trouble.
Everybody hear that okay?
I'm afraid I'm about to get killed.
All right, honey. Honey, I'm going to help you, okay? Are you at the Hilton Garden Inn right now?
Yes.
How old are you, honey?
I just turned 18. The people who are wanting to hurt me are just left.
What, now you're Barb?
So I'm in the hotel room.
Which hotel room are you in, Barb?
On floor 8 and on room 851.
851, did they just leave?
Yeah, but I'm afraid they're going to come back.
I'm going to help you right now. You're going to stay on the phone with me, and I will not hang up with you, okay? You promise me? Good girl. Now, who are those people? Do you know their names?
Yeah, one's name is Tyree Eric Jones, and the other one, I don't know her last name, but her name's Bianca.
What's going on with them?
Well, they sucked me into coming here, so I ran away from home. In the last couple of days, they've been threatening me and saying that I owe them money, and if I don't give them their money, they're going to kill me. And I hide appearances under my pillow because I'm afraid that I need to defend myself. I don't want to be in this
Don't worry,
anymore.
honey, I'm going to help you, okay? I promise. No, I'm sending somebody there to come help you right now. Now, the guy named Tyree, is he black?
Yes, Tyree Eric Jones is his name.
Tyree Eric Jones. Now, how old is Tyree, do you think?
He's 18.
18? Is he from Iowa, like you?
I think so, but he has family here in Minnesota.
All right. And what is the girl white, black, Mexican, Asian?
The girl's black.
Black female, what's her name?
Bianca.
And how old is Bianca, do you think?
I think she said she was 23.
23? What's Bianca's last name?
I think it's Nicole or something, but she said she has a warrant here in Minnesota.
Des Moines, Iowa. Iowa to come to Minnesota for what? Did they ever tell you?
They told me I was supposed to make money, and they've been making me see my guys, and now I'm afraid I have something.
Desiree, honey, I'm going to send you a doctor too, okay?
All right, thank you. If you couldn't hear the first part, that was just the young lady that was calling Ramsey County 911, indicating that she ran away from Iowa and she was calling from a hotel room in St. Paul. This is an example of what happens to this girl was 17 when she ran away. She turned 18 when she was here, but this is just a classic example of what can happen to a young girl that gets lured away from home and then finds herself end up with a pimp. She met the suspect. He talked her into coming to St. Paul. He arranged for her to perform a sex act in Iowa to earn money for the bus. Once she traveled to Minnesota, they picked her up. She was forced to have sex with the suspect the first night that she was here. She immediately started working for the suspect in a hotel in St. Paul. As you can see there, she had unprotected sex with several men. At one point while she was here, they used a scissors to cut her dress to make it a little bit shorter so they could take revealing pictures of her. They wanted her pictures to be a little bit more revealing. So they had to teach this young lady how to talk on the phone. She didn't know what to say to a John when a John would call, so they had to teach her how to talk on the phone and what questions to ask. At one point she fell asleep and she wasn't answering the phone in the hotel room, and they got mad at her because she's not answering the phone, they're not making money, right? So they became pretty irritated with her. This young lady had to be the girl that did it all. She couldn't have any rules, right? These men showed up and wanted to perform a sex act that they maybe weren't able to perform with their wife. She would have to do it with them. That's pretty common. They told her she was fat. She only ate once a day. You know, that's an interesting point about the food thing. If you speak with these girls or with advocates, that's one of the first things that they'll tell you, and Emily mentioned that, is buy them something to eat. Take them out to lunch. Send somebody to Subway. Get them a sandwich. Something pretty simple like that can go a long way as far as establishing trust or rapport with one of these young girls. As you heard, she called 911. Our officers responded to the scene. They took her to the hospital. The suspects had some other family members and then also were looking for her, so they went to the hospital to see if they could find her. Once they got down to the hospital, our officers arrested her. We followed up by doing a search warrant at the hotel, doing several interviews. This young lady had written a note to her mom, and the note said something to the effect of, "Mom, I fought a good fight." She left the names of the suspects in case she was killed, so officers would be able to find them. So you can imagine the amount of fear that this young lady was in when she's miles away from home, stuck in a hotel room, having sex with several men. She was 17 years old when she got here. She has Asperger's syndrome. As you'll see with most of these victims, they have several disorders, so to speak, after their name. Like you may have a degree or several degrees after your name. Most of these girls have several disorders after their name. And that's one question that we often have to ask these young ladies. And I generally wait till the very end of the interview just because it's a sensitive subject. But I certainly want to document in my report if this girl does have some personality disorders. She was pregnant at the time when she went back home. I'm assuming she's had the baby by now. I haven't followed up with her. But the good news is she was returned home. Her school welcomed her back, and she graduated from high school. This is just an example of some of the things that we would find when we would execute a search warrant at the hotel. You can see the greeting, the name. A lot of times they'll ask if you're law enforcement. The price is there. $80, $135 for a half hour, $175 for an hour. This is what was found in the trash. See the condom there, Snickers bar, might have been only what she ate that day. And underneath that is one of the Visa gift cards that I talked about. Every time you place an ad on Backpage, you have to pay, I believe it's $7. and these guys will use prepaid credit cards so it doesn't come back to them in order to pay for the ads. So that's where Backpage is making all of their money. This little piece of evidence would be important to us. It shows who the suspect was, who rented the room, right? He's paying for the room for this girl to be in. And this was the suspects in this case were Tyree Jones and Bianca Mixon, and they both ended up pleading guilty in Ramsey County to our felony charges. As far as the buyers, I have some stats here, whether we get to that or not. I might bring it up at the end, but we're doing a little profile in St. Paul right now as to who these men are. Last year we conducted 18 undercover sting operations, and we arrested 133 men for engaging in prostitution. So these gentlemen they're everybody. They're young, they're old, they're rich, they're poor. Majority of them are white, I will say that. And they're certainly married too, married with kids, you name it. As far as the kids that we're encountering, this is our juvenile missing person report from 2011, and you can see we have it broken down by race and by sex. In the bottom right corner there, the total. But one of the most alarming figures with this is if you look at the African American kids, and particularly the females. 580 of our total of 995 females that ran away were African American kids. So that's a population that we're most interested in, just simply because of the numbers. And you can see the other races there. Here's the broken down by gender and age. Females, again, are light blue on the slide. And then the age is down across the bottom. So ladies, at age 13, I don't know what happens to you, but you decide you want to leave the house, right? A lot of things going on in your life where you decide you want to take off. And look at it continues to go up from there, 13, 14, 15. So obviously the females are running away more than the males. Emily touched on it in her slide. If you look, the numbers start going back down again at age 16 and 17. And I don't have a real good answer for that, but I do think that after a while, parents simply stop reporting their kids that run away. They've reported them so many times at age 13 or 14. They're 15, 16 now. Nothing's been done. Same problems are occurring, so maybe they don't call the police quite as often. And there's another slide indicating the race analysis there. Again, females being in blue. If you look at the African American population versus all the other ones, those are our kids that we want to concentrate on. Those are the kids that we find most at risk. As far as the 10 questions that we're asking these kids, one of the things that we're doing in St. Paul is we want to try to identify these kids earlier on in the process. When a kid runs away, a report's made. When they come back home, that report is canceled. Our missing persons unit will try to follow up with that kid and ask them a series of questions as to what's going on in their life. And you can see the questions above. I won't read each and every one of them to you. We used to just ask the kids the questions, fill out the form, and it basically was filed. Now the officers, thanks to a grant from the Minnesota Girls Are Not for Sale campaign from the Women's Foundation, we're able to find a way to put the questions online so the officers can complete them just online when they're writing their regular reports. And then it automatically populates into the police report. So we're hoping that we can encourage more officers to ask these questions, and then that we'll be able to go back and look at the statistics, learn a little bit more about each and every one of these kids. And you can see we ask about drugs, alcohol, medical needs, sexual assault. And one of the biggest things that we want to encourage our officers to do is if they find out that another offense has taken place, is to write a separate police report. Recently we did several audits of our reports, and we discovered that some of this information would be documented just in the original Runaway report and not a new case number generated. If a young girl comes in and tells us that she was assaulted, we want that officer to create a new case number and write a brand new police report that will get assigned to an investigator. That's one of the things that we're working on, trying to improve. Tools for educators. Emily talked about some of this. This is certainly something that people see once they're aware of what the issue is or what the problem is. We receive calls from people. We get calls from principals that will all of a sudden tell us that she's starting to wear new jeans every day, $80 jeans. Seeing an older male pick her up after school in a nice car. Those things happen. As far as what we're doing in St. Paul and Ramsey County, we talked about the 10 questions. If you saw, recently we did the hotel training for several hotels in Ramsey County. Hennepin County also did it. We just got all the hotel managers and workers together to provide training for them on what to look for. We still have the Jerry Vick Task Force and the St. Paul Police Vice Unit in St. Paul. As far as I know, we're the only department in Minnesota that has a vice unit that continues to focus on this. I mentioned the Women's Foundation and the Minnesota Girls Are Not for Sale campaign. We're in our second year of receiving a grant from them to concentrate on this work. And the PDI class, that's our class for our training unit, puts on a class, and they actually did it the last couple days, where we have officers from around Minnesota and the Midwest that want to learn how to conduct these investigations or also to conduct these type of sting operations. So we provide training for other agencies. It's not uncommon for us to get a call from a community that has a problem, but they don't know what to do about it. They don't have undercover officers. They don't have policies or procedures in place on what an undercover officer could do in a vice, sting type situation. And so they'll call us, and oftentimes we'll have one of our undercover officers go out and assist another community just because they don't know what to do. Breaking Free is a nonprofit group, survivor-based organization in St. Paul that works with young women and girls getting out of the lifestyle. And we talked about the safe harbor law too. Why we need to collaborate. These cases are difficult cases to work. The more people that are aware of the issue, whether it's a probation officer or another agency that knows who to call, when to call, and what to report on, is just helpful and helps us make our cases stronger. The bottom line is we want to provide services for the victims. We want to provide long-term services for the victims, and we certainly want to do that with a victim-centered approach. One of the things that you're going to have to do with these victims is obviously establish trust, rapport. They're going to want to be safe. You're going to have to be able to communicate to them that you're able to provide for them and whatever services they need. We have down as shelter versus JDC. Oftentimes we might want to hang on to one of these kids for a night or two just to keep them safe, versus if we place them in an unlocked facility and they run again, what good have we done by taking them off the street just to allow them to run again, especially if they were to go back to the pimp. So, in finishing up, you may only have one chance to make an impression with these young girls. Don't treat them like a prostitute. Treat them like you'd want to treat somebody else that you were trying to help. Listen to them, advocate for them. And guys, sometimes these girls identify better with a woman. It's very common for us to take a male and a female officer when we go out to interact with one of these girls. If they see me walk into a room to talk to them, I got a couple things going against me, right? Number one, I look like the last John that she just saw. Number two, I'm carrying a badge. And then I'm supposed to sit down and have a conversation with this young girl. It's pretty difficult. They're difficult kids to deal with, and they don't open up often on the first time that you encounter them. Our goal, obviously, we want to arrest and prosecute men that are trafficking these girls, incarcerate them, and we need these kids in order to reach our goal. These are difficult victims for us to work with. A lot of times these kids don't want to be helped. They might not want to be helped, and they're a little bit like addicts, actually. They'll come and go from this lifestyle before they actually are able to get completely away from it. And lastly, I'll leave you with, what would you do if this was your kid? What would you want somebody else to do if it was your niece, your sister, or your granddaughter? There's Emily's contact information and my contact information. I have some handouts with me today. I didn't bring them up here, but I also have some cards if anybody's interested in getting a hold of us. Thank you.
Thank you so much, Emily and Ray. What I'd like you to do now is to take just a moment to reflect on some of what you've heard Emily and Ray talk about. And then at the signal, I'll ask you to turn, if you're able, and share that with one other person. So I'll give you a couple of minutes to share back and forth so that there's some cross-conversation, and then we'll have a Q&A with Ray and Emily. Okay, we'll start our Q&A. For those of you who are in Greater Minnesota, you can email your questions to us at cmh@umn.edu, and we'll be sure that Sergeant Gainey and Emily get those questions. For those of you who are here in McNamara, you've got index cards in the center of your tables. You can use those to either write your questions, or we've got people with handheld mics that will be walking around the room, and you can ask your question directly. So, any questions from Greater Minnesota?
Yes, I have one.
Okay.
This is a question for you, Ray, and this came from actually two of our sites. What were the charges brought against the people who solicited the girls? This was a question from both Duluth and Moorhead.
I believe it would have been a felony promoting prostitution charge.
And so do you know if they went to jail? There was a question about did they go to jail and for how long, and do you know that?
Yeah, I don't know the length of the sentence. A lot of times the length of the sentence will depend upon a criminal history, so I don't have the length of the sentence.
Thank you.
Any questions here in McNamara? Yes, we've got a question right here.
Can you explain why it's... And if you could just wait for the mic, that would be helpful. Thanks.
Can you explain why it's so important to have two separate forms filled out by the police, to have two separate ones? Or three?
With the 10 questions?
No, you said if there were different charges.
Right. Yeah. So when a kid runs away, a report is made about the initial missing persons report, and then when they're returned is when we want to ask them the 10 questions. And just because we have different units, depending upon what happens to that kid while they're gone, the results of those questions, if it's a separate offense, it might get assigned to a different unit. So we want to make sure that we generate a new case number, so it's not just, what we found was that some of the information gets lost if it's just in the missing persons report, that it doesn't get forwarded to a family violence type unit or something like that. So.
And just a follow-up to that, is your police paperwork getting done as it is, and isn't generating more reports going to be very difficult?
I don't think it'll be. I don't think it'll be more difficult. This last year we took a real in-depth look at how we're handling these kids, and we identified some what we felt were gaps in our system, and that was one of them. So if it generates another report, if there's a crime that's been committed, that's kind of what we're supposed to do.
I have a question for both of you, Ray and Emily. You talked a lot about what's going on in Ramsey County, and because we have viewers today who are from all over Minnesota, do you have any idea the incidence and the amount of intervention services in the rest of the state?
We did have a question, too, from Albert Lee asking that question specifically to Minneapolis, if they're doing anything like St. Paul.
Yes, Minneapolis actually has an investigator assigned to the VIC task force as well, so we do work with Minneapolis. And as far as services, there are other services in other parts of the states as well.
I think if you're in outside of the metro area or even within the metro area, contact your local rape crisis program, because they're going to be aware of the law changes that's going to be happening, as I mentioned earlier, on August 1st of 2014. They're going to be aware of that, and there's a lot of work happening right now at our state legislators, and they're addressing services and needs, and that is to be for the entire state of Minnesota, understanding that there are different needs in different communities, and so they're looking for feedback. So if you've got any desire to connect with somebody, feel free to send me an email and I can try to find the program in your area, or hopefully you're aware of some of the rape crisis programs in your community.
With some of the legislation, the no wrong door legislation, one of the proposals that they're suggesting is that we have a statewide coordinator or regional coordinators throughout the state to serve as a kind of a one-stop shop place for when a small town maybe would have a question about something, they would have a regional coordinator in their area that they could call.
We have another question.
Yes, we have a question from Hutchinson. How prevalent is the problem in greater Minnesota, and how many kids in the cities are being recruited from places in greater Minnesota? Do you know?
Yeah, I don't know that I would be able to speak too much about greater Minnesota. I certainly have traveled outside of the metro area to interview girls. We know that when girls run away sometimes, if they're in a small town, they might want to come to the big city. We have certainly seen that. You know, if one of the things that we've also found is that that these men or these pimps will recruit via social media. So I have teenagers, and they have more social media sites that they're on that I can even keep track of. And so the pimps will use some of these sites to contact kids. So even though they might not be able to contact a kid on the street in Minneapolis or St. Paul, they could also contact them via one of those sites.
Beth will be able to address some numbers statewide. It may not be specific to your community, but she can give you a sense of what's going on in the state with homelessness. I believe that we don't know a lot. There's a lot more information that we need to find, and some of those concrete numbers are out there. And victims don't come forward because they don't want to be identified. They're not seeing themselves as victims. So there's a lot of unknowns, and we are, I think, on the cusp of finding out much more information about the reality of this type of crime.
We have another question here in McNamara.
So you kind of already answered this. Sorry. So you kind of already answered this with the case study, but what happens when a victim does turn 18, and what's the line there?
Okay. Thank you. That question was asked at our table just in conversation also. So Breaking Free is the nonprofit agency that Ray spoke about, and they have been working with women who are prostituted for years. They are specifically addressing 16 to 21-year-olds. Often our services, our laws are designated by age, and at age 18, we're very aware that magically things don't start happening for you, and that you may have needs that are going to cross over well into what is considered legal adulthood. And we also know biologically about the development of the brain, that that's taking longer than we initially thought. So there's some of the physical health aspects that are influencing actions and interventions. But specifically, like I said, Breaking Free is addressing that and having some crossover services. So at 18, you're not, quote unquote, kicked out the door from whatever service you're receiving. It's a very important population. It's obviously a bridge in our development. And I think they're not going to be the only ones soon looking at that particular age group.
And then as far as prosecution, like that, if they're not prosecuted?
If they're not prosecuted, again, you know, magically at age 18, you are considered legally responsible for your actions. So I'm not sure I should say this or not, but what I have a hope for is that we're going to be doing some diversion. We're going to be looking at what's going on with an 18, 19, 20, 21-year-old, 24-year-old. Where do they come from? What's their history? And looking at some diversion options instead of charging that person who's being prostituted as an offender, and start looking at other ways of making the life trajectory better, healthier, more hopeful than being charged with a crime and being treated as an offender.
Along with that, if we encounter an adult, we always refer the women to Breaking Free to go through their program, and then we'll monitor that to see whether they were successful in graduating from their program or not, and that may also influence whether they're charged or not.
This question comes from Duluth. How do you respond to young women who are involved in recruiting other victims? Are they treated as victims or as criminals?
That is the best question of the day. You know, I would be tempted to open it up to the audience to try to answer that, and maybe we can get some opinions from the audience, but I'll attempt to answer that if I can. It's a great question. It's a difficult question, and, you know, at some point, these men that recruit these girls, they want to distance themselves from the illegal activity that they're involved in. So they're going to have another girl that may manage other girls. They might have a girl that collects the money from the other girls. They may have a girl that hands out the discipline if somebody doesn't make enough money. And so at some point, that girl becomes a little bit more responsible for what she's doing. She herself was probably a victim to start out. I think most of you would agree with me with that, right? But after she's been with this pimp for however long, at some point, in my mind, she kind of crosses that line by recruiting and forcing other girls into this. So it's a great question. It's a difficult question. I don't have to answer that. We let the county attorneys decide what to do in cases with that, but I would love to hear what the audience has to say about that as well.
Well, not to avoid that, but we need to stop for a break. So we'll resume promptly at 10:40.
Thank you.
Okay, welcome back. We are going to hear now from Beth Holger Ambrose, who is the Homeless Youth Services Coordinator for the Minnesota Human Services Department. And she will also introduce you to Gina, who she brought with her today, who will tell her own story about homelessness. So, Beth?
Thank you so much for coming to attend this training today and for the nice introduction. I just wanted to let you know I've had the great opportunity of my career to work with Runaway and youth experiencing homelessness and youth who have been trafficked since about the 90s. So I really appreciated the earlier presentation by Sergeant Gainey and Emily. It's always a tough act to follow, but I'm going to try to do my best. So I wanted to just kind of they gave a great example of a local program, one that I've actually worked with for a long time, the Runaway Intervention Project. And I would just like to kind of widen it out a little bit because I work on the state level. So I work with youth experiencing homelessness who have been exploited, all over the state. So I'll just kind of give you kind of a wider perspective. Let's see. So first of all, I get asked a lot, what a homeless youth is, and there's a lot of confusion if you don't work in the field about the fact that there are even homeless youth in Minnesota. So we see a lot of times confusion come between there's children who are homeless with their parents and their families, and we typically refer to them as homeless families. And then we also have children who are what we call unaccompanied, meaning that they're without their caregivers or legal guardians, and they're experiencing homelessness on their own. And so those youth, tend to be, in my experience, between the ages of 13 and 20, 22 or so. But I just kind of wanted to explain to you what we're talking about. We're talking about youth who are not with their families. And so our state law, the Minnesota Homeless Youth Act, which the statute's below here, just defines homeless youth as the slide up here. I won't read through it. But this is nice because we really do have a good law in place that gives good definitions of what a homeless youth is, runaway youth, as well as the services, the continuum of services that we provide for them in our state. Let's see. So again, this same law kind of talks about what the difference, like what actually homeless youth actually are. And so they're youth who are living in public or privately operated temporary shelter or an institution designed to provide temporary living accommodations, transitional housing, a temporary placement with a peer or a family member. So we oftentimes, like, this is the statute language, but oftentimes we just call it couch hopping or couch surfing. We also, public or private places that aren't designed or ordinarily used for sleeping accommodation. So I've worked with youth who have done incredible things. The most recent one I heard that was actually first was a youth out in Detroit Lakes that had snuck in and slept in a dog boarding kennel with the dogs because it was so cold up there. And so there's all kinds of things that youth who are homeless are doing to survive. We only have, which I'll get into later, 108 emergency shelter beds and 25 homeless youth each night. And so this forces youth to make incredibly difficult decisions. They're also, as I'll get into more later, incredibly resilient people that continue to inspire me daily. But yeah, the dog kennel was a new one for me. I worked with youth who have actually stayed in porta potties in public parks if it's really cold or raining during the night. Youth who have purposely gotten overnight jobs to have somewhere to go at night. Youth who sneak into abandoned buildings, hallways, basements of buildings, garages, all kinds of things, or sleep in their cars if they have a car, or sneak into somebody else's car if they leave it unlocked and sleep there. So there's all kinds of situations that could be deemed as not a public or private place that's ordinarily used for sleeping. Those are just some examples. So, and a youth who's homeless doesn't include someone who's incarcerated in the juvenile detention system or some other type of system like that. So another big misconception that I get all the time is, isn't a runaway youth the same thing as a youth who is homeless? And actually, they're quite different. They do have some similar experiences with trauma, unfortunately, which I'll talk about a little bit more later. But runaway youth are technically under the age of 18, and they do have a home. And I will just say that the runaway youth I worked with, they're not running away because they disagree with the rules or anything. It's that there's something serious going on in that house, and that's the reason they're running away. Usually it has to do with their own personal safety or acceptance. And so what we're seeing is even though these youth don't have a safe place to live necessarily, they do have some place, but they are running for it for some particular reason, and they're under the age of 18, and technically they're not, they're supposed to be at their home. The thing that oftentimes happen, I find, and I know that Sergeant Gainey talked about the different runaways that are reported, which is great. We also find a lot of runaway youth that are never reported in by their parents as missing. And he talked a little bit about 16 and 17-year-olds, and I definitely would add on that that's very true. We're seeing lots of youth, especially older youth, that are not being reported in to the police as runaways. They're just running away from home and then ending up on the streets, and their parents aren't looking for them or anything like that. So just to let you know, that's kind of the difference, and hopefully that makes sense. So the other question I get a lot of times is, Minnesota is such a nice place and everyone cares about each other here, and so we would never have youth homelessness here. And I can say I worked with homeless youth in every type of community. There are homeless youth in every kind of community, whether it's a rural community, whether it's a community on a tribal reservation, whether it's a community in the suburbs or in the inner city. So it's definitely not just something happening in Minneapolis and St. Paul, but all across our state. And so these are just some alarming, to me, statistics. So in a year, the total number of homeless youth who experience homelessness is over 22,000. And on any given night, so tonight, there's 2,500 different unaccompanied homeless youth that are going to be looking for somewhere or trying to figure out where they're going to sleep tonight. The Social Service Information System, if you're familiar with that, that's the Child Welfare Information System, also reports that there's each year between 500 and 550 unduplicated youth who run away from their county child welfare placement, like their foster home or group home, and then their cases are closed and they're never found. So oftentimes we're also seeing these youth ending up in the homeless youth kind of world or scene. So the other thing that's quite alarming, and I'll get into some more positives later because I realize this is kind of a lot of depressing information, but right now we have some incredible agencies providing services across our state. However, we do not have enough, and they do not have enough capacity to serve everyone. So what I did here is this is a little chart that lists out the acronyms. I'll just explain. So SOP stands for Street Outreach Program, which are programs that go out and locate and build relationships with youth and provide kind of immediate crisis supplies to youth, such as food and other kinds of things, and also referrals to emergency shelter or housing programs. Those are very critical, I think, in building up relationships with youth who are experiencing homelessness, as well as we found outreach. I've done specific outreach with the sexually exploited youth population on the street, and that's a very effective way, and also building up relationships in a harm reduction, we're in their area type of space. And so that works really well, just as the FYI, as an intervention with both sexually exploited and homeless youth. Unfortunately, as you can see, there's many parts of the state that don't have any programs. We do have street outreach workers in Hennepin and Ramsey County, and then some in rural areas, and as well as one of the reservations. Drop-in centers, we have 2 in Hennepin County, one's in Bloomington and one's in downtown Minneapolis here, and then we have 1 in St. Paul, and then we have 4 in the greater Minnesota area. And drop-in centers are places where youth can go in who are having a hard time and get access to a variety of services in a low-barrier, trauma-informed way. They can access things like mental health services, they can get signed up for housing programs, they can get free meals, showers, do their laundry, all kinds of different things within these programs. And they're very popular, I think, among many of the youth. We also have ES stands for emergency shelter. So we have only 108 emergency shelter beds statewide. And this is really scary because when you have someone who's experiencing homelessness, housing programs take some time to get into. You oftentimes have to get on a long waiting list, fill out forms, meet certain eligibility before you can get into a housing program. So emergency shelter is kind of the first step to getting youth off of the streets. And unfortunately, we just have 108 beds. So that's really, it makes us all very busy, and it's also very sad. So we're always trying to expand these services. We also have transitional living program. They are basically transitional housing programs that provide up to 18 to 24 months of supportive housing, along with case management and a variety of supportive services for youth. Permanent supportive housing or supportive housing, it's basically the same type of model, but there's an unlimited time of stay. So these 2 programs are also very critical, and we only have a little over 600 units of those. And so oftentimes, and Gina might speak to this too, but oftentimes there's long waiting lists to get into those programs, and so it's tough, again, to get youth in. So this is the reality right now. Now, it's very bleak, but I will say there's a lot of hope. So the community, including youth themselves, and homeless youth workers and a variety of other people, including Senator Dibble, have worked on a piece of legislation, the Homeless Youth Act, which earlier defined homeless and runaway youth. And we've worked on getting funding for that for all of these services. So that law also provides provisions to fund all of the services I just mentioned. And that law we've been working on since 2001 when it was first written in the basement of Streetworks. And currently, I'm really happy to say, 12 years later, for the first time, it's in the governor's budget at $5 million. And that just got released a couple weeks ago, and so we're hoping with a Democratic House and Senate that will go through. At least the ask is from the community is actually $8 million. And yesterday, at the governor had a reception on the Homeless Youth Act, and he said, quote unquote, I would support the full ask of $8 million. So we're really hoping we'll get that. Right now, prior to that, we were only able to get $238,000, which in the state budget is basically a rounding error, and we can only provide a couple youth with services. So we are very, very excited about what could happen. If we got that full $8 million, we could build out capacity in parts of the state that don't have services already, as well as build capacity in the metro area and other areas to serve more youth and provide more housing, among other things. So we're super excited. So there is good news. So I just wanted to kind of let you know that even though this looks very depressing, we're hoping that this summer we'll begin expanding all of these good interventions for homeless youth. So, like I said, the capacity gap, here's what we're looking at. So we have 108 emergency shelter beds and 605 units of housing designated for youth. That leaves a huge gap. So obviously we're trying to figure out the best thing we can do for youth and keeping them safe. And oftentimes there's many, many youth that don't even get connected with a service for a lot of different reasons, but the main reason being that there just isn't enough capacity. So again, we're hoping to build that out with additional funding through the Homeless Youth Act. So there are some really scary disparities as well. So within the homeless youth population, we're seeing African American youth and American Indian youth and LGBTQ youth represented at much higher rates than other youth. So, for example, African American youth make up 44% of our homeless youth population, but they only represent 8% of the general youth population in Minnesota. Similarly, we're seeing the same thing with American Indian youth, and we're also seeing high numbers of lesbian, bisexual, transgender youth out on the streets experiencing homelessness. I just want to mention a little bit about this one is that there's been, I was trying to wonder, why is that? Like, why are there so many? And I think that, there's things that are obvious to me of reasons why, but just to, let you know, since I'm in an academic setting, there are also academic research that backs that up, is that the University of San Francisco's Family Acceptance Project did a study where they found out that the average age has lowered of youth coming out. So in the 1970s, people were coming out as, gay, lesbian, bisexual, transgender when they were like in their college age years or like early 20s. And so oftentimes those young people would already be moved out of their parents' or caregivers' homes. Now we're seeing, which I think is a great thing, we're seeing younger and younger youth, and I see it all the time, coming out, and the average age is 13.5 years old. That is an amazing and great thing. The unfortunate side of that is they are maybe still living with their parents, they usually are, and those parents may or may not be accepting. So the same research also found that 1 out of 4 youth, once they came out at 13 or whatever age, would get kicked out of their home, or the home would be made so horribly abusive because of their orientation or gender identity that the youth chose to leave. And so that's why we are seeing, high rates of that. Obviously, there's systemic racism that goes on in a lot of different settings, which I think speaks to the disparities that we also see within the homeless youth populations with African American and American Indian youth. One thing I can say, though, is that our youth, we're finding that the homeless youth services are serving the majority. We are seeing them reach out, and they're serving. The majority of youth are serving are African American, which is really good. So that means at least these youth are feeling safe, and we have a lot of culturally specific programming that we try to make sure to tailor to them. The other thing is, in greater Minnesota, we did not have any homeless youth programs on reservations, which was horrible, right? Because if we're seeing American Indians as a disparity in our state among the homeless youth population, why in the world would we not have programs that are culturally specific for them on their reservation so they don't have to leave? And what I was hearing from youth and community members were youth don't want to leave the reservation. They don't want to go into the other rural white areas and experience what they were saying, racism or hatred there, where they wanted to stay on their own reservation, receive services in a culturally appropriate way there. And so we were able to get 4.5 years ago, we were able to get a federal demonstration pilot to open the first homeless youth transitional living programs on Boys Fort and Leech Lake Reservation, which are still in operation to this day. They're culturally specific. They have things like Ojibwe language classes for the youth. They have, in addition to all the normal supports for homeless youth, they have a lot of really great culturally specific programs. So that's been a huge benefit in our state. And now that's 2 of 11 reservations. So we're hoping to get more funds so we can expand that program out. So the other big question I oftentimes get is, why are youth homeless? So this is kind of the big question, and I will get into some of those reasons. The largest reason why we're seeing youth becoming homeless, and this is backed up by the Wilder Research Survey, which is done every 3 years in our state on the homeless population, the largest reason is that there's some type of severe family conflict. And when we say family conflict, we mean they're getting kicked out, they're getting abused, something at home is not right. So we don't mean a family conflict as in, I can't have the car this weekend. We mean like something severe is going on. The other reasons, we have sometimes it's kind of easy to always blame the parents with youth who are homeless. And when I first started in my career, I kind of was really frustrated with some of the things that parents were doing, and I still continue to be sometimes. But what I will say is that not every parent or legal guardian is able to care for their child even though they really want to. So we have some parents or guardians that they're suffering from their own trauma, they're suffering from their own mental illness or chemical dependency, or they're involved in criminal activity, and because of those things they're just not able to care for their child the way that they would want to. We also are seeing parents or legal guardians who are also homeless themselves, and maybe they're staying in a domestic abuse shelter that doesn't allow older youth or something like that. We're also seeing situations, especially I think more so when the economy tanked, where there isn't enough space for everyone in the house. So maybe a family gets a Section 8 voucher or some type of help to live in an apartment, and that, if you get a Section 8 voucher, you're not supposed to have kids over 18 living with you. Or, there's all kinds of things like that happen. Or maybe you have a one-bedroom apartment and you have 4 children, but the landlord finds out and is like, you're over occupancy for this apartment. And so then the older youth are forced to make some tough decisions to protect the younger youth. So we see situations like that happening a lot too. We also see some situations where parents are incarcerated, so the parents go to jail for something, or they're institutionalized in a mental health institution or treatment center, and then there aren't other relatives that are stable enough to take the child in. Oftentimes, or every once in a while, this is like more rare, but every once in a while we'll have a parent or a legal guardian who passes away, and then the same situation, there's just not another person that's stable enough or financially able to take that youth in. We also see youth, the big question and kind of the elephant in the room I always get is, well, why are there homeless youth when we have a child welfare system in our state? And I only have 10 minutes left, so I can't get into all of that, and it's a very kind of politically charged debate. But what I will say is that our child welfare system, it's pretty, there's a lot of pieces of that do need to get reformed. There's a lot of very good intentioned county welfare workers, so I'm not trying to criticize them, but the way the system is set up and the financial resources that the system gets makes it very difficult to take in all of the cases and all of the and support all of the families that need help. So it's not like any individual's fault, but it's kind of how the systemic system is set up, as well as how it's funded through federal dollars and kind of a lack of county and state support for that. So oftentimes what we're seeing is counties are faced with really hard decisions of, okay, I have a 2-year-old who's being abused. I've got a 15-year-old that's being abused. We're going to focus all of our placement dollars on younger kids because we feel like they're more vulnerable. And I can see that thinking, right? I mean, I think it's really, I personally feel like we need to be supporting every youth, but I also know that counties have really tough decisions to make, and so I just, we need to do a lot more with that system in order to, as well as our juvenile detention system and children's mental health system, to make sure that youth aren't transitioning out of these systems and experiencing homelessness as a result. So the other big reason why I think people here today are here today is to really talk about trauma and kind of learn about trauma. And what I will say is in the homeless youth field, as well as working with trafficked youth, we really have endorsed the trauma-informed care approach. Oftentimes, like when I first started in the field, we'd refer to it more as harm reduction and positive youth development because it incorporates a lot of those principles. But I'm going to speak to trauma-informed care, which is really critical when working with youth. Who are experiencing homelessness or who are trafficked or running away. And the reason I say that is, so first of all, this is what's really sad, is that youth who are experiencing homelessness, oftentimes, they self-report, half of them have experienced childhood abuse already. So prior to being homeless, they've been abused physically, sexually, emotionally, or all of those things. And so they've had this childhood history of being abused first. Then when they, oftentimes, then when they become actually, experience homelessness, then there's a lot of other set of traumas that happen. First of all, it's traumatizing not to know and have to worry about where you're going to sleep each night and whether or not you're going to be safe or whether or not the person you're sleeping on their couch is going to let you stay another night. That's traumatizing in itself. But we also see high rates of sexual exploitation among youth on the streets. So there's different academic research, 1 in 5, but most of them agree that 1 in 5 homeless youth have been exploited or trafficked. And I would say that that's true, like from the caseloads I've worked with. They also have higher chances of becoming depressed or suffering from post-traumatic stress disorder. Unfortunately, this one's very sad, but true, is that they also have higher rates of suicidal thoughts and suicide attempts. And they also have higher chances of, while being out experiencing homelessness being physically or sexually assaulted or victimized by a violent crime. They're much more vulnerable. I will say just a little bit about the sexual exploitation is that in Minneapolis here, Sergeant Schneider, who I know isn't here today, but every case of trafficked youth that he had from 2012 was either a runaway or a homeless youth. So we're seeing a lot of runaway and homeless youth in Minnesota that are also being, unfortunately, exploited. We also have higher chances of youth becoming pregnant or contracting STDs. So the importance of trauma-informed care, I mean, I think that last slide kind of said it all, but the importance of trauma-informed care is really that when you're working with a youth who's experienced homelessness or who has run away from home or who's been trafficked, it's really important to use trauma-informed care approach because all of these youth have experienced not just one incidence of trauma, but multiple instances and multiple types of trauma. And so we cannot just work with them as if they haven't experienced that trauma. So it's very critical and important. Also, it's going to make your relationship with the youth much stronger, and it's also going to make your programs much stronger. So the trauma-informed care kind of framework I wanted to talk about, I think trauma-informed care, like I said, really includes using a harm reduction approach with youth. So you look at youth as they are, which I believe is incredibly resilient, smart, young people who have had horrific circumstances but have worked really hard to survive and overcome them. And like I said, I'm not exaggerating when I say I continue to be inspired every day by the young people that I get the opportunity to work with. They are incredible people. They're not bad kids. You hear that all the time. I don't personally think they're difficult to work with. I know some people say that. I think that they're amazing to work with. I love working with them. And so I just really feel like it's important, though, to recognize that they've had this level of trauma. And when you are kind of looking at working with them, you want to make sure to use a strength-based approach. So looking at them as if, okay, this behavior, I'll give you an example. I was going to kind of, give examples as well. But a trauma and care approach would be looking at a youth for their strengths and looking at their behavior as not bad, but just something that's a result of their trauma. So for example, I was working at the bridge and I was upstairs in my office, and one day I hear one of the young girls, she's about 16, who's living in the transitional living program, yell up the stairs to me, "Beth, you better get down here, I'm gonna beat your staff's ass." And I was like, okay. So some people would respond this way. A non-trauma informed care response to that youth would have been to run downstairs, call the cops, arrest the kid, do all this stuff, right? That is not trauma informed. So what I did, and I knew the youth, I had a relationship, had already done the work of building up the relationship, because that's also an important part of trauma informed care. I calmly walked down the stairs because I knew if she heard me coming down that she knew she had my attention, right? So I started walking down the stairs and I was like, "Are you okay? Like, what's going on? Are you doing okay? What's going on? I can see you're pretty pissed off right now. Like, what's happening? And just let her explain to me and talk to me. And she actually calmed down. And then I had the other staff leave for the rest of the day to kind of defuse the situation that was happening. And she just needed to kind of vent and talk to somebody. And then literally the next day she was fine with that staff. And so I think sometimes we just need to make sure to be very respectful, to look at it from a strength-based way. If I would have run down the stairs and yelled at her for swearing or for threatening the staff, that would have totally backfired. And that's not what even without trauma-informed care, that's not how I would want to operate, and many people in our field operate. But that's just kind of an example of how to incorporate day-to-day things. Other kind of agency-wide things would be to identify agency policies and procedures that really include trauma and make sure to train staff on trauma-informed care approaches. Consider universal trauma screening and any intake procedures. And then also set realistic program outcomes. I cannot say this enough. So another example of a non-trauma-informed care approach would be programs that say, okay, if you drink or use drugs, you're kicked out. So there are some programs that still do that, not as many. We're kind of moving away from that. But that to me is very not trauma-informed. So if a youth is using alcohol or drugs, just like adults that use, oftentimes there's a reason, and we need to be understanding of that and not judgmental about it and allow youth to come back home. Youth who are housed with their parents normally would not get kicked out if they came home under the influence. I didn't, okay? So I know lots of other people that didn't. So I don't think it's fair for us to do that with youth homelessness, and that's another kind of trauma-informed thing that we need to really work on. So setting realistic program rules and outcomes for the youth that you're working with is really important. Another one that I love is youth are going to be employed by after 30 days of being in the program. Well, that's not realistic if the youth has experienced all kinds of trauma and can't even get up regularly in the morning. So you need to really think about setting up outcomes and rules for the program that are trauma informed, that make sense for the population and aren't going to set those youth and your program up to fail. Also, you want to consider kind of the context of their life experiences, just like I did with that 16-year-old. I gave you an example of what I handled right. Now, especially in my earlier career, but still, there's times where I haven't done things right. I'm not perfect for sure, and Gina and other people in the room can attest to that. But I feel we need to make sure to as much interactions with youth, just looking at them, not judging the behavior, not judging them, not getting upset and taking it personally if they call you a name or something, but really understanding it that is a result of their traumatic experiences. And then also finding out what interests the youth and really building at that, finding out what interests the youth and what's strength-based. And I'll give an example. We had a young person who was really struggling, and he loved basketball. And so I was like, well, why don't you set up a basketball, a weekly, or bi-weekly basketball time, in the TLP, if that's what you like to do, if you don't want to sit around and watch TV, or if you don't want to just do work on your life skills, because he felt like he was doing, forced to do too much of that kind of stuff. Why don't we set up a basketball program? So he did that, and I was like, oh man, now I'm going to have to go and play basketball, and I'm horrible at basketball. But so when I was at the Bridge, he did that, and it was hugely popular with the youth, and they did love laughing at me. And thankfully, every time we would go down to the park, I'm like, please don't let me see anybody I know. But it was a really good experience. And so whatever the youth, this is another thing about being flexible. Find out what the youth interests are that you're working with and build on those and figure out ways to incorporate those. Because that oftentimes is, just as adults, I want to do stuff I'm interested in, so it makes sense that young people would too. And also just, I can't say enough about understanding drug and alcohol abuse and understanding and not being judgmental of that, or behavior, or poor decision making. I hear that sometimes, these are bad kids that are making poor decisions. Actually, no, they're making decisions for how they feel like they can survive based on the traumatic experiences they have been. So we as adults and people need to really flip the script in how we're thinking about that, because that just doesn't make sense. And then also, in terms of systemic examples, I just wanted to say that the system examples would be in our new safe harbor law, where we're working on creating a new response that's not juvenile detention for youth who have been exploited. We're incorporating trauma-informed care from every piece of it, from street outreach, training, regional navigators that work with the youth, all the way to the permanent supportive housing. It's really infused from the beginning. We have that in the legislation that's moving through the House and the Senate this session. And then also within our homeless youth programs, we're also kind of, especially the federal government has thankfully made a push to include trauma-informed care. So we're also kind of reforming a lot of what we do in our homeless youth services as well. So the last, and I also wanted to give a plug for the Hollywood Homeless Youth Partnership. They are incredible. I've worked with them. They're out in LA. It's a collaborative of a bunch of different street outreach, shelter, healthcare, housing programs for homeless youth in the LA area. They do amazing work, and so we put in a bunch of different documents from them around trauma-informed care. They've done a lot of good work around that, and so I just wanted to make sure to highlight that, and you can read it as your leisure. And then I just also wanted to add in one last slide here, is just that, again, these are some statistics of who homeless youth are, or youth who have experienced homelessness are. They could be anybody. They could be who's checking you out at the grocery store. They could be the polite person that delivers your newspaper. They could be anybody. You never know. There is no stereotypical way that a youth who experiences homelessness looks or acts or anything like that. I will also just leave you with this comment that homeless youth, when I worked at one of the shelters I worked with in South Minneapolis at Avenues, there was we were also happened to be the Black Club leaders. So one day we had the Black Party in front of the shelter, and all the youth helped with it, and it was a really great event. And the guy that was living across the street came over, and he's like, "This is a homeless youth shelter?" And I was like, "Yeah, how did you not know that?" And he said, "I always thought it was just a nice group of college students living here." So this is, people really give a bad stereotype, but I can tell you after years of working with these young people, they're the most amazing people I've ever met. And to prove that, I brought someone that did experience homelessness as a youth with me. She's quite amazing. Her name's Gina Fuller, and she's going to talk a little bit about her own experience, whatever she feels comfortable sharing. But I just wanted, because she's very humble, I just wanted to brag about her a little bit. She is quite amazing. She experienced homelessness as a youth, which she'll talk about, but she currently is working full-time, often more than full-time, at Safe Zone as a street outreach worker with other youth. So she has chosen to dedicate her career to giving back, and she's really incredible. She also happens to be helping me co-facilitate a rural listening session project right now. And she's also currently applying for another job. And I'm like, okay, I don't know when she's going to sleep. But so she's really, really, really done incredible things. And she also is still currently living in a housing program through YouthLink. And has maintained her housing there for quite a while. So I can't say enough good things about her. She speaks well beyond her years. You won't even realize she's as young as she is. But I'm going to go ahead and turn it over to her because she's pretty amazing. So thank you very much.
Hello. My name is Gina Fuller, and I am 21 years old. I just want to start off by saying that I struggled with homelessness from the age of 9 years old to 20. Some sort of homelessness for that long, but I'll just start off by saying that at 9 years old I was diagnosed with diabetes, and my mother was an alcoholic. I was going, through my diabetic doctors, they would, ask a couple of questions whenever I came into the clinic for my appointments, because they could sense, my mother's alcoholism. They could, smell it on her breath and other things. And they removed me from my home because they felt my mother couldn't help me take care of my diabetes. But the first time I was removed from my house in foster care, I felt like they just used it as a scare tactic because I was only gone for a week. I was removed again when I was 10 years old, 10 or 11, for a year. And it was both traumatizing for me and my sister because we were placed in a group home at St. Joseph's Home for Youth, or Home for Children, sorry about that, for about 2 or 3 weeks. And I really fought really hard to keep us together because I was told that, a lot of siblings get split apart during foster care, and I was not going to let that happen. And, as a 10-year-old, kind of fighting for that was a little bit difficult for me. But we were placed in a foster home in Plymouth. And my sister was, of course, removed from her school. I stayed in the school that I was attending because I went to the Fair Fine Arts School in Crystal, and it was a inter-district school, so they had kids from all over the Twin Cities, so I could get bused back to that school. But me and my sister didn't stay there for too long because my diabetes was too much for the foster parents to handle. And so we were put back into the foster care system, and we stayed with somebody in North Minneapolis. But our foster mother was pretty much abusive then. She would rough handle my little sister and her other foster kids. I had a really bad problem with bedwetting back then, and she actually, I would wear like Depend diapers, and she actually took a diaper that I was wearing and made me go on the school bus with it on top of my head. And she, I remember one time actually going from church, and she went into the store for something, and my sister and some of her adoptive children were like running around in the truck, and she came back and caught them like running around in the truck, and she just like slammed them against the car. Like, I remember that very vividly. After that, me and my sister were placed back in home. It also seemed that we were removed, well, I was removed every summer since 4th grade. But, yeah, so I was removed again in 6th grade, the summer of 6th grade. And I remember going to the different like court hearings to fight for my sister to stay home. And that was probably the only reason why my sister did stay home. And they removed me and placed me in St. Joe's again, where I was bullied every single day that I stayed there for a different reason. Either I was too quiet, or I was too loud, or too nerdy, or something. And I talked to my guardian ad litem to be removed from St. Joe's, and I was placed into another group home with mostly older kids. I think I was 12 at the time, and most of the kids in the group home were between the ages of like 15 and 17. And we all shared the same living space, and they would sneak boys into the space that we all shared, and I would sit there while they had sex. And they threatened me that if I told anybody that they would beat the crap out of me. So of course I didn't tell anybody. You know, they were older than me. I was scared. So after that, they placed me back at home. But the multiple times I was removed from home, it severely traumatized my mom. Let's see, the first time I was removed into foster care, I stayed home because I missed the bus, and school was in Crystal. My mother didn't drive, so there was really no way for me to get to school. My mom was at work at the time, so she didn't get to see me before I was removed. And ever since then, she was afraid to go to work because of that trauma of her being at work and feeling like she couldn't like help the situation. I believe I suffered more abuse in the system than I would have at home. And my mom constantly blamed herself for that. When I was 15, I left home on my own because my brother was really abusive. And my brother is almost 20 years older than I am, and there were constant physical fights, and my mother's drinking got really bad then. So, yeah, my room at home, I didn't really have a door, so I couldn't close it and just, be by myself. And when I left, I stayed with one friend for about 1.5 years to 2 years. But I was kicked out because of a fight that she got into with her daughter. And I stayed with another friend then for a little while. But I had to leave there because there wasn't enough room. I went to stay at the Bridge, but I had a cold when I went to the Bridge, and I couldn't stay there because I guess they didn't want me to contaminate the other residents. So I moved back in with another friend for a little while, but the first friend I stayed with, her mother contacted me and wanted me to move back in. And I just thought, because she realized that I didn't have anything to do with the fight with her daughter and everything, and I didn't really have anywhere to go. But really it turned out that she heard about some help I was getting from my school. They had, found out that I was homeless and couch hopping, and they gave me a couple gift cards for Steve & Barry's when that was still around. And she found out about that, so she wanted me to come back home so she could reap the benefits. But, you know, of course that didn't last long, because as soon as the help from school stopped, then I was kicked out again. And I went to the bridge and stayed there for maybe 2 weeks and contacted my older sister, and she said I could come and stay with her. So I stayed with her for a little bit, but she was 21 at the time. So, you know, she had her own life going on, and she stayed with roommates, and they had younger kids, and, you know, I wasn't contributing to the money or stuff like that, so I was kicked out, and I went back to the bridge and didn't have anywhere else to go or anybody else I could call or lean on, so they sent me back home, which was 2 days before my 17th birthday, and the electricity was out. I definitely remember that. But after I went home that last time, a friend told me about YouthLink, so I started going to YouthLink. I would go there right after school and stay till 8. And then, you know, YouthLink helped me get into, like, to find, like, salvation through art. They really helped me with that, and that helped me, like, excel. And through YouthLink, I also found Full Cycle Bike Shop, which is in South Minneapolis, and they have a program where they employ youth to be bike mechanics, and they help youth find, like, stable housing and more permanent employment. And through Full Cycle, I applied for St. Barnabas, which is where I'm staying now. But the first time I applied for St. Barnabas, I was denied because I was staying at my mother's house. And I remember talking on the phone to the lady who was doing my interview, and I was like, well, can I come in and talk to you? Like, can we figure something out? Because this isn't necessarily the place I should be or the place I feel stable and comfortable with. And she did not want to hear that. I think she may have hung up the phone on me too, actually. But like being at Full Cycle, I had an advocate there that could vouch for me. And I got into St. Barnabas, and then there was an opportunity that arose at Safe Zone for a peer outreach worker. And I applied and got the job, and yeah, now I'm just like pushing myself forward to be a youth advocate and speak for those who can't really speak for themselves or have a hard time speaking for themselves. And I wish I would have known about StreetWorks when I was their age, because it definitely could have helped me. So that's my story.
Thank you very much, Beth and Gina. We're now going to hear from Dr. Mark Hudson, who's at the Children Resource Center. He's a pediatrician there, works with children, and he'll tell you about his experiences.
Well, at least that's not hard to follow. So we're going to pull up a PowerPoint here, hopefully. All right. So my name is Mark Hudson, and I am a pediatrician. I'm what's called a child abuse pediatrician. And I'm going to talk to you a little bit about what we're doing in our clinic and what is primarily being spearheaded by one of my colleagues that is unfortunately on vacation. Hence, you're stuck with me and not her. But a little background, I want to talk to you a little bit about kind of how we're approaching kind of runaway youth, and I think our approach sort of is shaped by our background. So, as I mentioned, the clinic that I work is a subspecialty clinic of Children's Hospitals and Clinics of Minnesota. It's called Midwest Children's Resource Center. And it's a clinic that's focused exclusively on evaluation of child abuse and neglect. So traditionally, we have seen children who have been physically abused in their homes, children who have been sexually abused in their homes. And in addition to being a subspecialty clinic, we're what's called a child advocacy center. Okay, and a child advocacy center, there's multiple child advocacy centers in the state. There's multiple child advocacy centers in the country, and there's many different models. Ours happens to be a medical model. But central to child advocacy centers is a philosophy of sort of a multidisciplinary approach to child abuse. Many times that involves child protection, involves law enforcement, it involves advocacy, it involves therapy, it involves medical. And child advocacy centers really grew out of the idea and an approach that kids do better, everyone does better, when child abuse is approached from a multidisciplinary approach. Okay, so if law enforcement is communicating with child protection is communicating with advocacy, etc. Not only do kids get a better outcome, okay, because they're not being interviewed and everyone approaching from their own standpoint. So not only do kids get a better outcome, but many times the professionals get a better outcome. Okay, so the police end up with a better case. Child protection ends up with a better case. And so, you know, my colleague, her name is Laurel Edinburgh, and she's a nurse practitioner, and she's the one who kind of got us involved in getting involved with Runaway Youth. And what happened was she ended up seeing some kids that weren't sort of our traditional kids. They were kids that were actually had left home. They were young kids, 12, 13 years old. She actually started to talk to them about what happened. It turns out a lot of things happened to these kids. And started to look at things and, you know, and said, you know, whose problem? And I don't know if the problem is necessarily the right word for this, but, you know, who's responsible for runaway youth? And I'm talking mostly, when I'm going to talk today, I'm going to talk mostly about runaway youth. We don't do a lot of work with sort of the homeless youth. But, you know, is it a problem for child protection? Well, I think there certainly is a role for child protection. Is it a problem for law enforcement? Is there criminal activities that happens? Definitely, okay? Is this a problem for probation or delinquency? And certainly sometimes that's the case, okay? My colleague said, you know what, this is also a medical problem, okay? And she realized that, you know, these issues often cross across multiple disciplines. You know, it does involve law enforcement, it does involve child protection, it does involve advocacy, it does involve probation and delinquency. But there's clearly a health role. And so the things that I'm going to talk to you a little bit about today is, one, sort of approaching runaway vulnerable youth from a multidisciplinary approach. Okay, so this isn't one person's problem, and sort of I think we've heard from a lot of different disciplines, and we've heard from advocacy and public health, we've heard from law enforcement, and I think one of the things that I want to sort of wrap together is that, and I hope you got this from the other presenters as well, is that really in Ramsey County we're really trying to approach this from a coordinated response and really be thinking about these kids from multiple angles. And I'm going to make the other thing I'm going to do is really make a pitch for sort of the health consequences of children who are running away. Okay, so just a little background and a little bit that sort of went into my colleague's thoughts when she said, "How are we going to approach this?" You know, and I think we're going to cover a lot of this. Okay, but we're going to go quickly because a lot of this has been covered. Okay, but you know, really when we think about kids who are running away, many times they actually start running away at a young age, but they might get sort of overlooked. So there's not a lot of necessarily services for the kids that are 10 to 14 years old, okay? Because these are kids that sort of, they might not be, you know, first of all, be able to navigate to get to the shelter, and then they may show up at the shelter and you say, "You're 12 years old, you're too young to be here with our 17-year-olds, okay? And so it's a really a young and vulnerable population. And the other thing that plays in this, and Emily certainly spoke to this, and multiple people have touched on this, but young kids' brains aren't developed, okay? So they are really, really vulnerable. They don't have the resources. I think many people would argue that, you know, an 18-year-old doesn't have the cognitive resources to really be an adult and to really avoid victimization. And certainly when you ratchet that down to being 12 years old, it amplifies the problem, okay? We know that every time a kid runs away, their risk of being victimized increases, okay? And teens that are younger when they first run are more likely to be involved in high-risk and health-compromising behaviors. Okay, and when I talk about health behaviors, I'm going to talk about those a little bit more. But things that we're really thinking about is suicidality, self-harm, substance use, substance abuse, sexual abuse, physical abuse, exploitation. You might argue some of those aren't just a health problem, but I'm going to say that they're a major health problem. Okay? Females often run at an earlier age than males. Compared to boys, girls tend to experience a little more sexual abuse in their homes before they leave. Now, interestingly, boys are as likely to, we think boys are probably as likely to report sexual exploitation as girls, okay? But they're less likely to disclose it when they're in a face-to-face meeting. Okay, so getting that information from boys, I think, is somewhat difficult, and we're going to talk mostly about girls because I think the boys are still a tough nut to crack, and I'm not going to pretend that we've solved issues for girls, but boys are even tougher, I think. Okay. Interestingly, when we talk about youth that are running from home, and I think Beth certainly talked about many times, there's a history of being sexually abused or sexually or physically abused at home. But actually, once they're on the street, many times they're worse off than they're in their home. Okay, so in other words, they're more likely to be abused outside their home than more of the kids that we're seeing as runaways have been abused outside their home than inside. Okay, so certainly there's plenty of overlap. Okay, a little bit more background. We touched on this as well. Beth touched on the large number of GLBT youth that are runaway and homeless, and certainly we know that they seem to be at increased risk of being sexually assaulted. Okay. Interestingly, when we look at the runaway youth or homeless youth, many of them are still attending schools. Okay. High risk of, I touched on this already, high risk of risky behaviors, including drug use and unprotected sex. Most risk behavior begins at an early age. Okay. Many of the youth that are running have pretty serious consequences. They might have diabetes. They might have other mental health issues, and treatment is really difficult when kids aren't in a stable situation. Okay. Interestingly, if you're a girl who runs away, 1 in 3 become sexually active within 12 months of running away. Okay? So if you want to think about a runaway at 12 and you do the math, she's only 13 when she starts to become sexually active. Okay? So I'm going to talk about one particular health consequence, and only just because I think the numbers are sort of interesting, but I want to talk about pregnancy. Okay? So if you are a youth in Minnesota, teen pregnancy rate of about 10%. Okay? If you've been a survivor of incest, your teen pregnancy rate jumps to about 21%. If you're abused outside the family, you're about 1 in 3 chance of being pregnant while you're a teenager. Okay? Abused outside the family, plus you've had a suicide attempt, we're ratcheting up to about 40% chance of being pregnant as a teenager. Abuse outside the family, involvement in the delinquency system, suicide attempt and injection drug use, 70% chance that you're going to be pregnant as a teen. Okay? Now, interestingly, abuse outside the family, plus a suicide attempt, plus some protective factors, and we can ratchet that rate down to about 10%. Okay? And so these are the things that my colleagues said, this is some baseline data, and she said, well, how can we address this? What can we do? Well, she thought of, maybe we can look at increasing those protective factors and trying to get these kids back on a different trajectory. And so, as a child advocacy center, one of the things that we do is we see kids and we evaluate for abuse. Physical abuse, sexual abuse is typical. And we started to see kids that have been runaway. Okay? And where are those kids coming from? Well, currently, we're getting kids from a number of different sources. Okay? We get kids that come from the police. Okay, so the missing persons unit from the police department is out, and they locate a kid, and they ask these 10 questions, and that kid says that I've been assaulted, I've been sexually abused, and we get those kids referred to us to see them. Okay, we get kids that are coming from the court system, so kids are in courts for truancy. Okay, and a truancy. And the court system identifies that, these aren't kids that are truant and staying at home with their mom, they're truant and they're missing. And those kids get referred to say, okay, what else is going on? And we do an evaluation on those. We get kids from school, we get kids from the probation system. Okay? And what does our evaluation look like? What do we do? Well, we really approach these kids from a healthcare standpoint. And we start with sort of a paper-based assessment based on the Minnesota Student Survey. Okay, so the Minnesota Student Survey is that survey that everyone gets to take in school. Okay, and we've taken a portion out of that. And there's a couple of things that we use that for. One, we use that as a really good screen for risky behaviors. Okay, so it talks about when was the last time you drank, how much do you drink, when's the last time you had sex, did you use a condom when you had sex. Okay, so that's a really good way for us to help to start to screen. Okay, the other thing that we do with this is we use it for data. Okay, so we can track our kids and we can figure out, are we doing anything that's any good or not. Okay, we also do a paper-based PTSD screen. So we know a lot of kids that have been run away. We know kids that have experienced intrafamilial abuse, extrafamilial abuse. They've got a lot of PTSD symptoms. Okay, now I'm not a therapist or anything like that, but we use a nice paper-based screen to say, okay, how much trauma do we think these kids are experiencing that can help us inform what kind of a care plan we want to be thinking about. Okay, and then really we do a really just sort of what amounts to teen medicine. Okay. And when we talk about teen medicine, we often talk about a thing called a HEADS assessment. It means home, education, activities, drugs, and sex. Okay, those are the topics we want to cover. So we're going to talk about how are things going at home. We're going to review some of the stuff on the MSS. Talk about home relationships, education, activities that kids are involved in, alcohol, drugs. We're going to screen for things like depression. Okay. And then we want to offer, and so that can help us to sort of inform, okay, what kind of risks are these kids at? What kind of health care needs do these kids require? We do a fair amount of health teaching. Okay, much of that is frankly around sexuality. Okay, safe sex. Here's a condom. Here's how you put it on, and teaching about some of those health care issues that are pertinent to this particular population. Okay, we actually offer immediate access to birth control. Okay, so one of the things that we know about kids when we're talking, and many of the kids that we're talking about are sort of middle school age kids. Okay, you might have lots of feelings about 12-year-olds, 13-year-olds, 14-year-olds being on birth control, but the reality is that many of the runaway kids are at huge risk for pregnancy. They're at huge risk for sexually transmitted infections and things like that. And we know that being pregnant at 12, 13, 14 years old is a bad thing. Okay? We also know that when you leave our clinic, it's hard for a 13-year-old to access health care. Okay? So maybe by the time you're 17 years old, you've figured out how to get into either a clinic or a free clinic and access some birth control. Maybe you're in a school that has a Health Start clinic that Ramsey County happens to call a Health Start, a school-based clinic that you can get birth control. But when you're 13 years old in 8th grade and they don't have a Health Start clinic, then very difficult to get birth control. Okay? So we look at immediate access to birth control because we know that they're at incredibly high risk. And we think about referrals for ongoing services. Okay? Many times we're referring kids, directly out of our office, maybe to an inpatient psych assessment. Okay, now anyone who's tried to make that happen knows that that's not always the easiest thing, and those resources aren't particularly available. But we're also talking about tying these kids back. When we see a child, and we're seeing mostly Ramsey County kids through this program, we like to get a release of information so that if they have a Health Start clinic, we can coordinate with the school health nurse about this kid's ongoing health care. Okay. And then it brings us to I'll talk a few more things. We also, because we are a child advocacy center and we're very used to working with child protection, used to working with law enforcement, we actually do a video recorded interview with the kid. Okay, and we do this with video. We do a video recorded interview with kids that are anywhere from 3 to 18, and we've been done this for years. We do this when kids are reporting sexual abuse. Okay, and we do it with our teens as well. If they're saying, "Hey, I've been a victim of a crime," what we do is we go through and take a very detailed history in a as least traumatic way as possible about all the details of what's happened to them. Okay, we like to record all of those details of the event, what that kid was exposed to, who they were with, as much information as they can get, and we video record that. Okay, and many times these kids are reporting intrafamilial abuse, extrafamilial abuse, or both. okay? And that creates a little bit of a challenge for us, okay, because we are mandated reporters. And so when children are reporting intrafamilial abuse, we're mandated to report, okay? That's a child abuse, that's mandated report, and so we report that. Many times, however, we're talking to kids who are reporting things that are extrafamilial abuse. And that area gets a little bit more gray, okay? Because it's not a person in a position of authority. We're not talking about a teacher or something like that. We're talking about a kid now who's coming to get health care, and they're talking about a traumatic event, and we're providing health care around that. So part of that, what we generally do with those kids is if they don't want to report to the police, that's fine, okay? If they say, I don't want to record it, we say that's fine. But generally, what kids will say is, if they don't want to report it, we'll say, you know what, but let's record it so that we know what we talked about. If you ever want to come back to this, there's no question. And most kids will say, yeah, you know what, that's fine. And then, you know what, as we work with them over time, and maybe as they get involved with more advocacy, they may decide at some point in the future that, you know what, I want to make a report about that thing that happened to me because that's a crime, and I want the police to know about that. And we've got that data available. All right. Okay, we talked a little bit about I'm looking. Wait, I'm looking at. There are too many screens to look at. Sorry. So many times we're making those reports. Right now, it's about a little over half of the kids that we're seeing, somewhere around about 60% of the kids that we see, and we're talking about kids that are sort of 12 to 16 or so, and they're coming to us from the police, they're coming to us from child protection, or they're coming to us from police or courts. About 50 to 60% of those kids are reporting an abuse or assault that hasn't been reported before. It's just that someone actually is asking them what happened, and we want to provide treatment, and they're actually willing to tell. Okay? Sometimes that, and I made mention of us recording some of that information, sometimes that becomes a part of the police case, sometimes part of the investigation, it maybe even becomes part of a criminal prosecution. Okay. Let me just check my time. Okay. Then it comes to really, what I really want to talk to you guys about is sort of what we're doing from an intervention standpoint. So we see a fair amount of kids, and we sometimes see kids who are running away, and they haven't been sexually abused or assaulted. We do have an ongoing program where those kids are meeting with a therapist in a group setting, and we're trying to sort of nip that in the bud and control and try to prevent things from getting worse. Okay? Well, what I really want to talk to you about is a program that my colleague developed, and it's called the Runaway Intervention Program. And this is focused primarily on the younger teens. Okay, we are seeing kids up to about 17 right now, but typically we've thought of this as kids that are 12 to 15 years of age. Really, when you're thinking about those kids, these are the sort of the middle school kids. Okay, and these are kids that we're trying to screen that have run away from home. Okay, and that runaway might be overnight. Okay, that runaway might be a week. That runaway might be 2 weeks. It might be months away. Okay, but they've run away from home and they've experienced sexual abuse or assault. Okay. And what we developed, and what my colleague, well, I should say we, because I really wasn't that important to this, looked at all the data, and realized that, you know what, future risks, developed the goal of reducing future risks, okay, and improving outcomes for the runaway girls who are sexually abused or exploited, okay? And so one of the things that we want to focus on is reducing the traumatic response, okay? So we know, Beth mentioned, your brain changes when you have trauma, okay? And so these kids have been changed. And so we want to sort of think about how can we mitigate that traumatic response, okay? And we want to improve some health behaviors. We want to do things like decrease substance use and abuse. And, like Beth said, this isn't, we're going to offer you services unless you use alcohol, then you're going to be kicked out. Okay, so we're going to look at what can we do to reduce those things. What can we do to increase safe sex? What can we do to decrease sex overall? Okay, so, because we know that this is one of the major health risks for kids. Okay, and so one of the goals of the RIP program is to build resiliency. Okay, so resiliency, we've heard that word mentioned a couple of times, I think, today already. And one definition is doing well in spite of negative exposures and risks that would normally lead to adverse outcomes, usually because of protective assets. Okay, so protective assets seem to be important, and this is what my colleague sort of identified when she started to look at this data and say, what can help change this trajectory. And one of those things is protective assets. Okay? So what can be protective factors? Well, we know that kids who are more connected to school or more connected to their family do better. Okay. Now, interestingly, I found it sort of interesting that when in the earlier presentations, one of the things that we see that the pimps are doing is they're trying to decrease connection to school. They're trying to decrease connection to family. Okay, and that is a setup for kids to do worse. And while they probably didn't read it in a textbook, they've figured that out. Okay, we know that kids who are connected do better. Okay, we know they do better if they have supportive relationships with peers. They know they're better if they're involved in other activities. Maybe that's religious or spiritual activities. We know that kids that are involved in extracurricular activities tend to do better. Okay? So, what kind of services did she develop, and what kind of things did we think about when we were when she was developing this program? Well, one of the things that we offer is weekly group meetings. And these are meetings that are run by a therapist, okay? And it happens out of our office in St. Paul, okay? And they talk about a lot of things, okay? A lot of things like making safe choices, okay? A lot of health education, a lot of talking about the stressors that are going on in the girls' lives. And this is run by a licensed therapist, okay? Now, a couple of things you say, well, geez, how are you going to get a bunch of teen kids to come to a group meeting? And ironically, this group meeting there is no end date, okay? So it's not like you get 10 sessions and you're done, okay? There's no end date, and the girls will continue to come back and come back and come back, okay? So in other words, they seem to be getting something out of it. One of the things that we figured out right away was key. Transportation, okay? So there's a van that drives around and picks up the girls and brings them to group, okay? Another thing, food, okay? So whether you're hungry because you don't have food or whether you just like a treat, food seems to be a really important thing to getting kids to group, okay? All right. Then, so we talked about sort of some weekly group services. The other thing and sort of another major portion of this, is that we have pediatric nurse practitioners. There's 2 pediatric nurse practitioners employed currently that follow the kids in the community. Okay? And so that means they're following the kids. They're meeting them at school. They're meeting them at home. And they'll follow them for up to a year. Okay? And what are they doing? Well, some case management, okay? So they're trying to sort of figure out where do these kids need to be, helping them get the services that they need, okay? So if the kid needs therapy, let's figure out how we're going to get that kid into a therapist. That's above and beyond what we're doing through the RIP program already. Doing some family education, okay? So that is sometimes education around trauma responses, education around, hey, this might be what's going on with your kid, education around this is some of the stuff that's normal for teenagers, this is some of the stuff that's not normal for teenagers. Truancy intervention is needed, so kids get enrolled and they know full well that if we know that they're not going to school, they are going to be reported from a truancy standpoint. And our nurse practitioners actually follow the kids. They're at the truancy hearing with the kids. Okay? And then ongoing health care. So a lot of education, okay? And a lot of that is education about things like drugs, things like alcohol, things about how drugs, alcohol, sex, how you negotiate condom use if you're going to have sex, okay? So realizing full well that, maybe from a personal standpoint, I don't want to talk about a 13-year-old having sex, but if that's the reality, figuring out how are we going to help that 13-year-old negotiate how she's going to use a condom when she's having sex with an 18-year-old boy. Okay, now you might argue that hey, that's a bad situation right from the start, and I'm not going to argue with you, but if it's going to happen, how are you going to help that 13-year-old because she doesn't have the skills at baseline to negotiate condom use with a partner because she's 13, okay? That's a hard thing for anybody. It's a really hard thing for young girls. Okay, so a lot of ongoing health care, access to birth control, access to screening for sexually transmitted infections, access to treatment for these things, okay? Working a lot with connection to skill building and positive youth development activities. So that means getting kids back involved with their schools. So sometimes that means the nurse practitioner is actually meeting with the school guidance counselor, meeting with the teachers, figuring out how we get that kid to school, figuring out youth programs for the summertime, okay? And you might say, well, some of this stuff really isn't healthcare, right? You know, getting a kid enrolled in the Y camp for summer isn't traditionally thought as healthcare. But I think when we know is that the risks are so high and the health consequences are so high that this is good healthcare intervention, okay? And then the other things that we're doing as we do this is we're following these children with the screening tool. I mentioned we use a screening tool that's based on the MSS, the Minnesota Student Survey. We're screening those kids at 6 months and a year, okay? And so I want to present a little data from, this is a little bit older data, but this is data that was from the first 2 years. And this is actually data I think that ended in 2010, so it's a little bit older. Or maybe it's even older than that. I can't remember if it published in 2010 or what the exact years are on this data. But what my partner Laurel did is she looked at the first 68 girls, okay, who are enrolled in this RIP program, okay? And these girls at baseline reported severe levels of trauma, okay? Lots of sexual assault, lots of sexual exploitation, sometimes multiply assaulted, okay? So of those 16 girls, 14% had experienced prostitution. And remember, we're talking about girls that are in this time in sort of that 12 to 15-year-old middle school range. 6% had reported a gang rape. Okay? 30% sexual abuse by multiple perpetrators at different times. Okay? So this is not being sexually assaulted once. This is being sexually assaulted more than one time. Okay? 26% reported abuse by the same person, so multiple assaults, same person. 23% reported sexual assault one time by one perpetrator. Okay, so, you know, only 23% were reporting that. One reported a rape by a stranger. Okay, so most times, as, you know, I'm sure everyone's aware that, and we all teach our children about the person who's going to jump out of the bushes, but that's not how kids get assaulted or abused. Okay, 4% reported incest in addition to extrafamilial abuse. Okay, so this was a high-risk group. Okay, on entry, okay, 68 girls, 58% were doing some cutting. Okay, so these girls were high risk from a self-harm behavior. 50% had reported a suicidal ideation, and 20% had reported a suicide attempt within the past year. Okay? Most were not involved in school, and they reported being very disconnected from school or any positive role model. Okay? From a protective factor standpoint, you know, we looked at, or from a protective standpoint, at entry, they didn't have much for protection. They were not involved. They were not connected. Okay? So looking at those girls at 6 and 12 months, 100% were back in school. Okay? Not only enrolled, but were attending school. On the MSS, they reported improved self-esteem, improved ability to talk to their mother about their problems, and improved family connectedness. Okay? And they reported they had increased feelings of being cared about by other adults. Okay? They recorded higher educational aspirations. Okay, so one of the things that's interesting, if you say to a kid, you know what do you want to do? What do you want to do after school? And they say, they don't have an answer, that's really high risk. Okay, but if you can say, what do you want to do? And they say, I want to do something. It doesn't matter if you think it's a great thing to do. If they can say, I want to do something, that's a huge protective thing. Okay, they reported lower emotional distress. I'm going to show you some slides of this stuff as well. Reduced use of drugs and alcohol, including crystal meth and ecstasy. Okay? Improved use of contraception. And then maybe most interestingly, okay, pregnancy rate of 6%. Okay, remember what I said the baseline rate was before was 10%? 6% for this high-risk group of girls. Now you say, okay, well, it's only a year, and maybe those effects aren't going to last. And I'm maybe not going to argue with you on that. We're looking at that data, trying to figure that out. But if you go from 14 and being pregnant to 15 and being pregnant, you've already gone over at least a bit of a hurdle. Okay. So a little bit about this in sort of graph form. Okay. So on the left side, and the graphs that you're really what we're showing here in these graphs is our RIP girls, our runaway intervention girls at 0. Okay. That's the first bar. The second bar is the MSS girls. So this is girls across our state who are reporting abuse on their MSS. Okay. Third bar, our RIP girls at 12 months, and then the last bar is the MSS, so our general population who has not reported abuse. So suicidal attempts, I talked about this before, 52% on entry. At 1 year, 0% of the girls had reported suicide attempt during that year. Okay? Lower than MSS non-abused girls. Okay? Marijuana use in the past month, 77% versus 28% for girls that are not running and have been abused. By a year, those girls looked like their peers. So about 9% were using, they looked like their peers who had never experienced abuse. Okay? Condom use, last condom use, 23%. Okay, so doing a much worse job of negotiating condom use during sex at baseline. By the end of the year, by the end of intense health teaching and talking to them about condom use and the importance of birth control, they were doing a better job than the average population at using condoms when they had sex. Okay? A few more. Family connectedness, okay? And so the last graph, high was bad. This graph, high is good. So family connectedness, lower than girls on the MSS that had been abused at baseline, and not up to the non-abused girls by a year end, but significant improvement, okay? Self-esteem, again, sort of starting at sort of the low end, and then ending pretty much right similar to the MSS girls who were not reporting any abuse. Emotional distress, decreased emotional distress, okay? High emotional distress, similar to other girls who've been abused, and lower emotional distress at the end. Okay. So, then 68 girls, Laurel Edinburgh wanted to look and say, okay, who did better? Okay, who did better at through this program? And interestingly, there was no difference by age, ethnicity, or type of abuse. Okay, so they all seemed to do better, and that whether you were abused 3 times by multiple perpetrators or you had a single episode of abuse didn't seem to be a predictor. So in other words, they all got better. Okay. And those who at baseline had the lowest level of connectedness and lowest self-esteem and the highest distress improved the most, okay? And so you'd say, well, yeah, that makes sense. If you're doing bad, it's easier to improve more. But the flip side of that is if you're starting at a bad place, you've got less to build on, okay? So the flip side is many people would speculate, you know what, if you've got some protective coming in, you're going to do better. Turns out we were able to get even those girls that didn't have a lot of connectedness at the beginning to do better. Okay. And I think I'm going to finish on time. Wait, I went to the next person's already. Okay, so I think we've piloted here. We're currently following about 75 girls in the community for a year. We've piloted a program that seems to be extremely effective for highly vulnerable runaway girls. Okay, really, this is a strength-based approach. Really, focused on improving protective factors and looking at risk outcomes. And it seems that we can really, with the right intervention, we can really help to restore a healthy developmental trajectory for many of these kids who have been in these high-risk situations. All right. I think I ended on time. Thank you.
Stay here? Nope, you can go sit down for right now. So what I'd like you all to do is to take a moment and reflect on what you've heard and how you might use this in your particular area of work with youth. And then after you've given this some thought, if you would be willing or able to share this with somebody near you, that would be fine. I know that this isn't a lot of reflection time, so I hope sometime over the next day or two that you'll spend some time thinking about how you want to use this information to advance and impact your work with youth. So those of you who are in Greater Minnesota, please remember to send your questions to cmh@umn.edu. If there are questions that don't get answered today, please continue to send those to our email address, and we will submit those to our speakers and then put the questions and answers, we'll post those on our website next week. Those of you who are here, please make use of the index cards or the microphones. Do we have any questions right now for Beth or Mark?
First of all, I want to say thank you. I learned a lot, and the perspective of the medical, the criminal, as well as the state's movement is really appreciated. One of the aha moments for me was the middle school age challenges. I'm working with young people who are being bullied right now, and I really want your perspective on what are our middle schools doing to identify these young people who are struggling with what we're talking about today in particular.
Okay. Well, I certainly won't claim to be an expert on what's happening in all of the schools around the state or anything like that. But I will say I think even in our metro, in our Ramsey County school, there's a fair amount of variability on what's happening within the school to screen for these type of things. And I think that ranges anywhere from schools that are doing a really good job of sort of identifying this kid isn't here, they should be here. They're identifying that this is a kid who could be at great risk and trying to tie them in with services. And I think there are certainly some schools that are doing a great job of that. And that ranges all the way to schools that really are pretty clueless to even think about the fact that this could be happening or could be going on with some of their students. So I think that's sort of a non-answer I've given you.
I just want to reiterate Mark's non-answer, which is that it really depends on the school. So I definitely am not an expert at what all middle schools are doing. I think some schools are doing a lot of efforts around anti-bullying. Anoka-Hennepin district is now forced to, thanks to a lawsuit. So there are a lot of schools that are doing some things, and then there are some that aren't, and it just depends on the middle school. One thing I will say about the homeless youth in particular, although it's not perfect, because again it's district by district, but each school district by federal law has to have a homeless school liaison. And I know that in some schools, like the Minneapolis St. Paul, it's amazing. There's some other areas of the state where the homeless school liaison does an amazing job. As you heard Gina say, her homeless school liaison kind of helped her out a little bit. But there are some districts where the person doesn't even know that that's been added to their title. So it kind of depends on the district in terms of like homeless students getting access to the services homeless liaisons are supposed to provide is transportation, help with food, making sure that they get enrolled in the school they last went to, and also help with, just if they can, help with referrals to shelter or housing programs.
And I'll just make my pitch regarding asking the question. If you don't ask, you're not going to find out. And if you don't have some sensitivity, some education around how do you ask the questions and what do you do when you get a yes, you're not going to ask the questions, and then we're never going to identify those youth either.
A related question from Greater Minnesota. Are there any resources we can share with teachers to help them identify kids who have been exploited?
We are currently working on that. I will say, so our state, I know that Emily spoke a lot to this, as well as Sergeant Katie, but our state passed a safe harbor law in 2011, which decriminalizes prostitution offenses for youth under the age of 18. However, we are currently working on figuring out what types of curriculums. We're looking around at different models around in the country, and there's some really good ones. There's one out of Boston, My Life, My Choice, that's been really good with students in schools, and so we might try to, in 2014, hopefully bring that into Minnesota. In terms of educators, we're also looking at, through the Safe Harbor No Wrong Door comprehensive response we're trying to build in our state by August 1st, 2014, we have like a long list of people and sectors that we want to educate around the issue of sexual exploitation. In school, teachers and counselors are definitely one of the groups we want to do at least an annual training for. So, but we have a long way to go on it. It's not done yet.
We have a few more questions here in McNamara.
I have a question for Mark. I'm from Minnesota Indian Women's Resource Center. I run a program it's called Ocean Akijwe. It's a harm reduction program for girls in sexual exploitation. I've got about 26. I've got about 26 girls ranging in age of 11 to the age of 21. And I just wanted to know, what is the referral process for your program?
Well, I think there's a couple ways that I'd answer that. When we look at kids that we will evaluate, really we'll evaluate pretty much anybody, okay? and make some recommendations. And so that referral process is really where pretty much an open door kind of a situation where we'll pretty much make an appointment for anyone. For the specifically the runaway and following the youth in the community, that is at this point a grant-funded program, and it's restricted to Ramsey County children.
There's another question, I think, here. Joan?
Could you refer us to a comprehensive listing of student services that are available so that we can access that? Is there a comprehensive list or website for student services, in particular homeless student services?
I have one I definitely have shared with, I don't know how many schools have it.
I'm not talking about schools now. I'm saying if I wanted to hop online and find what in the metro area are student services, what's available to them, whether they're homeless or runaway or whatever, is there a comprehensive listing for that?
I am not quite sure about that. I think there is in the Minneapolis Public School District that they have a website. I know St. Paul has a brochure. I don't know if they have a website. Do you know?
I don't know.
Okay.
Are you speaking for professionals looking for service, or are you talking about like a resource?
For example, I've been doing
kid?
some work with YouthLink, and a lot of people have never heard of it, and I'm just wondering, is there a website that one can go to access certain names and organizations that service homeless youth?
It's an ever-changing target. It changes, honestly, every time I do this presentation, like the number of beds or the number of agencies or this or that. But we do have, if you go to the Minnesota Coalition for the Homeless or Youth Moving Forward website, they do keep, like the same list of, basically that I do, of different sets of services for homeless youth. And people oftentimes, I'm happy, if anybody wants to email me, I'd be happy to share that information with you, the most updated version as well.
Thank you.
Other questions? Yes.
We have a question from Moorhead for Mark. With the Runaway Project that you talked about, you spoke about following up with the girls for 1 year. Sorry. Oh, sorry. You spoke about following up with the girls for 1 year. Can you tell us a little bit about what you know about what happens after that 1 year?
I don't think we've got that data yet to know a lot of that. Certainly we do hear, of course, you hear the bad things, and so we know that, it has not changed everyone's life for the better forever, and there have certainly been some outcomes that have not been favorable in the long term. But we don't have that data on a large enough set to make any great inferences from.
Hi, my question is for both Mark and Beth. It's a pretty specific question. I've become more interested in the field of mobile health or using technologies like cell phone technology, SMS, to improve health and improve resilience. And I know there's been limited work since it's an early field, but also there has been some work done with homeless populations and even more restricted work done with the homeless youth. And I was wondering in Minnesota if there's any projects that are underway or if this is something that's been explored as a potential avenue.
Well, okay, so I'll talk a little bit. About what, and I think sort of that mobile health, and I think you used the term mobile health, and by that I'm assuming you're meaning some technology-driven access. I think there's a number of ways that the RIP program is using things along those lines, as far as making sure that we're communicating with the kids in the way that they want to be communicated with, which is many times through the text and things like that. We also have just started to, we've just purchased some mini iPads for the program to do more health teaching on the go from a multimedia standpoint. Whether that's going to be effective or not, I'm not sure. And I don't know if that really speaks to the question that you were asking.
I could say, so far we have, I'm definitely not a technology expert. We have found that street outreach is a really, really good link for youth and service providers in the homeless youth field. But we also I know that Target Foundation recently funded a project to work with Wilder Research Center and the Bridge and some other providers about trying to create an app, on phones that have youth services. But I will say, and one of the things I caution, I think that that's great, but not all youth who are experiencing homelessness have cell phones regularly. Like oftentimes youth that I've worked with, they might have one, like a prepaid phone for a little while, and then it gets shut off because they can't pay the bill, et cetera, et cetera. So we also just need to make sure to keep that in mind, that people that are stably housed, it's a different use of technology than those that are not. So.
Gina had also indicated that she's comfortable with people asking her questions.
Oh, yeah.
She just prefers to stay seated where she is. So
did we. Did we not tell you that?
Yeah, I didn't know that was an option.
I would say that if you're over 30, I think that's safe, right?
You guys can stay.
Oh!
Nice try.
Okay, the light's so bright, I can't see people's hands.
I just really wanted to thank you for your sharing and just applaud you for your strength. And just having gone through everything that you experienced, even from early years, are there things that you would wish you would have been able to have connected with, or resources or efforts that you think would be really helpful to have available to children, be it in the school system, in the community, or elsewhere, that you think would make a difference to people today? And what recommendations might you have for any of us who are interested in trying to reach out and assist in prevention and also support?
I think in response, I would say just like, if I would have known about StreetWorks, I think that would have helped me a lot, because there are people that are a little closer to, my age that I could have talked to, that I would have felt like I could trust more. And also having a little bit more support throughout the whole foster care system would have been really, really nice. Like, I felt like I was alone a lot during that. And I kind of felt like also I was being forced to, at the time it kind of felt like I was being forced to, I guess you can say, like, tattle on my mother and situations like that. I didn't necessarily feel like I should have been in foster care, but now thinking back on it, it probably did help a little bit. But just the whole process going about it felt kind of condemning. Also, I just want to throw out there that StreetWorks is working on a website right now. The website is going to be www.streetworksminnesota.org. And on the website, it's going to have all the outreach workers and their phone numbers throughout Ramsey County and Hennepin County, and all the youth-serving agencies and their times of operation, and all of the different shelter bids and their availability, and their like how to get there on the buses, and their phone numbers. So I think that will help a lot too.
And for those of you that are not familiar with StreetWorks, it's a great organization that's a collaborative of everyone that in the metro area that does street outreach. So Safe Zone's a part of it, the Bridge, I'm sorry, the Bridge isn't currently, but they used to be. So there's a number of agencies that are a part of this collaborative, so that all street outreach workers are trained on the same philosophy of youth work, share a common calendar of outreach schedules and locations and everything like that. So I just didn't know if everyone's familiar with that organization. It's a great organization, and Gina, of course, is one of the best outreach workers out there. So you are.
Are there other questions? Yes.
There's several more from Greater Minnesota.
Good.
One specific one, does doubling up qualify under the McKinney-Vento Act?
Yes. It's an easy question. Thank you.
Another one from Duluth. What is being done, if you can say a bit more about prevention?
We were listening.
Oh, sorry.
Question about prevention. If you can say a bit more about what's being done
For
about
prevention of trafficking or prevention of homelessness?
I think prevention of homeless youth.
Oh, okay. There is, what's being done about that? There is a statewide family homeless prevention and assistance program run out of Minnesota Housing that gives grants to local agencies. And what they try to do, it's for all populations of the homeless. And so they try to, like, if someone has arrears, like meaning back rent owed and things like that, then the fund can be used to pay that so that the family doesn't become homeless. And then in particular for youth, kind of some of the prevention tactics that work well are doing family reunification at a very early age, like when the youth is younger. And when I say family reunification, I don't necessarily mean reunifying the youth with whoever they were just living with. I mean looking at all of the options in their life, and if there's anyone that's stable and financially secure enough that really that the youth also wants to and agrees to live with. If the youth doesn't want to live there, it's not going to work. The reunification is not going to work. But so family reunification in a broad sense, not just necessarily blood related, is a really good, I think, prevention method with youth, as well as trying to, like I said, there are a lot of improvements that are being worked on currently with our child welfare system, but also really trying to work on that system to increase the strength of it in terms of older youth. I think Gina's experience was, unfortunately, with that system not uncommon, and so we need to really, in order to prevent those youth from becoming and experiencing homelessness like she did, really work on fixing some of those things. And those are, I will say, both at the Department of Human Services and in the community, they are being worked on, but there's a lot of work that needs to be done. So.
Any other questions?
I have a couple more. Oh, there's
Okay.
one in the room. Let's take that one first.
Thank you. I have another one. I was really struck by a very good TED Talk that I saw regarding mobile outreach through a website called DoSomething.org, who started getting some calls from help of text messages from adolescents who were experiencing things, and they were not originally set up to receive these texts. So they started to set up some outreach options to have crisis options for youth to text when they had concerns. I was just wondering if there are any similar resources that any of you might be aware of that are starting to evolve regarding comprehensive safety net and reaching out as well as support options. And then also piggybacking on that, thinking about how you had mentioned that about 25% of youth who were homeless were in school systems. I was curious about the rate of our ability to identify those youth and any additional options that are underway to help to identify those youth and screen as effectively as possible in meaningful ways.
Well, I am a repeater of the same words. And when you ask about can we identify them, I say yes, you can, and you're not going to unless you ask the questions. And so I keep saying that to many audiences, that we need to figure out a way in our discipline, in our experiences, in our setting, what is appropriate questions to ask, what do we want to be asking about, and what are we prepared to respond to. So I think schools, considering kids are with those people in that school for 6 to 8 hours a day, 40 hours a year, 40 weeks a year, they have a lot of visual time with those kids. And I think schools are in a unique position and poised to do something more if they have the resources, if they have the time. I come from a family of teachers, and I've had family members say to me, if I ask, I don't have time to respond. I've got a lot of other things going on. And so those are some of the inherent things I think are going on in schools. But again, if you want to do something, I would take it back to your community, which could be your school, and start addressing this within your team there on campus. What can we be doing? Who should we be asking? And what do we do when we find out homelessness, running, truancy, abuse at home, whatever it may be? Do you want to do the technology question?
Yeah, I could just say that the agencies, like the homeless youth agencies, many of them do have, first of all, Facebook pages, and so youth can contact people, staff through Facebook pages at many of the agencies. Also, street outreach workers, as well as case managers and program staff at the different homeless youth agencies all have, I mean, as far as I know, pretty much everyone has textability, and we are definitely seeing texts come in from youth that need help, so we're definitely seeing a lot of texting, you know, more so than before. So I would say yes to that. And then I'm trying to remember the other. I'll just say, like, with the McKinney-Vento, you know, I think that the McKinney-Vento homeless liaisons within the school districts have gotten, since I first started in the late 90s in this field, have gotten way better. Like, there's still room to, you know, keep continuing to improve. But, like, for example, I know that there are some school districts that kept reporting, like, 0 students experiencing homelessness. And I was like, that is not possible, because I just worked with a youth from that school district last week. And so, but what's happening now is more and more homeless liaisons and communities in general are becoming aware of this issue. There's been a lot more advocacy and a lot more kind of awareness building around the issue of youth homelessness. And so we are seeing school districts really stepping up, like school districts like down in Rochester and southeast Minnesota. I mean, just doing some great work around identifying students. But we still, like I said, it kind of depends district to district, so we still have a long ways to go. But also, it's not just identifying them, it's identifying them and then providing a good trauma-informed care and supportive, you know, positive response to that, because you know, you want to make sure to have an approach or a response once you've identified them, so you don't just leave them hanging. So,
and I think you all touched on this, how important it is that this be collaborative, that no one group of people can take care of this. Teachers can't deal with it by themselves, or physicians, nurses, county commissioners. We need a team of people to look at this issue. We have run out of time for questions, but please send them to us, cmh@umn.edu, and we will be sure that they get answered, and then we'll post them on our website. In the few minutes that are remaining, I'd like to ask you to fill out your evaluation surveys. We value your responses. If there are things that are of great interest to you that you would like us to consider presenting, you may indicate that as well. And then as you leave through the McNamara door to my right, you can pick up your certificates. And for those in Greater Minnesota and are viewing us online, you can also get your certificates. Social workers will have that test up by Tuesday. Thank you again, presenters. And thank you for participants. We wouldn't be here without you all, so thank you for coming.